Bella.
Hello, you must be Wendy.
I am.
And this must be Bella, a bully. Oh, look at you. Look how gorgeous you are.
Beautiful.
Oh. I've always loved English Bull Terriers ever since I had my own. It was the first dog I had after I finished uni. His name was Zed. Looked like he'd rip your arm off, but as soft and sweet as they come. Oh, yes. Hey, perfectly kissable face, that one. I think if people haven't had a Bull Terrier before, they might look at them and just take them at face value and think that's an aggressive dog. But for people that know how wonderful a Bull Terrier can be, they're going to grab them and take them home.
She's loving the attention, isn't she? She's...
Bella was left without a home after her elderly owner passed away. And now Wendy is concerned about a lump she has found on the Bull Terrier's face.
We've come along to Scott for him to check her out today, and hopefully somebody will come along and snap her up. But I must say I'm melting a little bit for her.
Wherever this owner is, she is thinking that Bella is in the absolute right place with you. I can tell that.
I'm getting sort of like a little bit attached to her.
Oh, really?
Wendy is now seriously considering adopting Bella, but she is still grieving the recent loss of her last 2 Bull Terriers. Bieber was 11 years old, but Bubbles was just an 11-month-old puppy when she died unexpectedly.
And we had that deep pang within your stomach that you can't feel. You just can't feel it. And as soon as we saw Bella, it was like both of them have come to greet me. Well, I miss them so much.
Yeah.
And she's helped feel that pang. I'm going to start again, sorry. Excuse me. She's just amazing. Fostering Bella's really helped and really taken that dreadful emptiness, and the house seems like a home again.
After so much heartbreak, Wendy is hoping Scott will be able to reassure her that Bella has no serious health issues.
I was concerned about these lumps that's on her nose here, this one in particular.
This lump on her face is not normal.
No.
Has it grown? Well, I suppose you've only had her a few days.
I have noticed that it is slightly larger since Friday.
Well, I mean, I definitely think that if it's grown in just a few days, then it's definitely something that we need to address.
It was there, but not quite as prominent.
Okay.
Bella will now need surgery, so the lump can be removed and tested.
I feel that although your relationship is very new, that you need to take the brave step to consider having her under anaesthetic.
I was dreading you were going to say that, but I know it's got to be done. It's treatment that's got to be done, so thank you.
Poor Wendy, she's so invested in Bella already, but she's still in such a fragile state after losing her 2 dogs. I'm so glad that you're emotionally involved with her already, and I can see why. She's beautiful.
Got to get her sorted first.
Yeah.
Please.
And as far as this lump's concerned, I can't give any assurances that it's going to be good news. In fact, it could turn out to be cancer. And that's the last thing this wonderful woman needs. We're going to get you right. Yes, we are. We're going to get you right. Hey? We'll see if we can convince Wendy to have you, shall we? Yeah, shall we?
You getting everything ready?
Yes.
Got my gloves. You're gonna need them.
Gemma, what are those?
They're my gauntlets.
At Scott's Isleworth Clinic, Nurse Gemma and newly graduated vet Riaz are on duty.
Are we fighting with some wolverines today?
No, we're going to try and catch stray cats.
A family in nearby Hounslow, which cares for stray cats in the area, is now needing help to look after a newly born litter of 10 kittens.
So today we're doing a house visit for a lovely lady who's actually being a bit overwhelmed at the moment. So Gemma and I are bringing everything that we need together to go visit these cats. Gemma's also included a pair of what I can only describe as gauntlets. I'm not entirely sure what that means for the rest of this afternoon. Perhaps the cats are quite large, but we're going to have to go there and have a look. Oh, God.
This is your initiation at becoming a new vet.
I thought I'd just bring, like a muzzle or something and...
Good luck getting the muzzle on the wild cat.
The gloves are an extra precaution.
Oh! Bit me on the nose.
After Gemma's last feline encounter left her scarred.
I'm probably the worst cat catcher out of the whole team. I'm not sure why I've been chosen to go. I don't know if it's maybe a punishment from Scott. Maybe I've done something naughty.
Just to clarify, when we say we, I thought
You. You're gonna
I thought you were catching the cats.
No. You're gonna catch them, so I might lend them to you.
I didn't agree to this. I have no idea what I've got myself into, have I?
No. Should we go?
Let's do it. I'll grab the gloves.
Oh, and don't forget the cat box.
Good thinking, Gemma.
Because Riaz is a new vet, I don't think he quite knows what he's letting himself in for.
Off we go. Road trip.
Road trip.
Meet Bella.
Hi, Bella. An English Bull Terrier. I love English Bull Terriers.
They are fantastic, aren't they?
Look at her.
No, look at the tail on it.
I love how they just go in all directions.
Back in Richmond, nurses Emma and Sam are preparing Bella for surgery.
She's gorgeous. Look at this face.
The 9-year-old Bull Terrier has recently gone into foster care after her elderly owner passed away.
So she's got a little lump here, which we're going to be removing.
Poor Bella.
Yeah. I am quite worried about this lump on Bella's nose. I really don't know what it is right now, but I can't rule out cancer. Okay, let's get cracking. Because we've got a lump that's growing quite quickly in a short space of time, that is one of the warning signs of potential cancer. So we do need to just act fast, get it out, and send it off to the lab and find out what it is, and hopefully it's nothing too nasty. It's being a little tricky because it's actually underneath a muscle layer.
Oh.
There you are. So you can see the little lump I'm trying to remove there now. Just there.
It doesn't look like a fat lump.
No, it's actually quite hard, sort of gristly. I'm hoping it might not be anything nasty, but I just don't know with this one. I have removed the lump in its entirety, and that's brilliant. But now it's the agonising wait to find out what the pathologist at the lab has to say about it, and I really hope it's good news. Let's get you all settled into a nice comfy cage and then call your hopefully soon-to-be mummy. Yeah.
Oh, I think you need to get the gauntlets ready.
4 miles away in Hounslow, rookie vet Riaz and nurse Gemma are answering a call for help from a local family. They've been looking after the homeless neighbourhood cats since they moved to the area 10 years ago.
Riaz, I think we got the right house.
I think the cats have got us outnumbered here. As a newly qualified vet, it's slightly weird for me actually going to people's houses and seeing their animals for myself. Normally, we get the animals coming into clinic, but so far I've seen quite a varied caseload. So yeah, I'm really enjoying it, and it's nice to be out and about and actually getting my hands dirty with it.
There's another one over there. Hiya, I'm Gemma, and this is Riaz. We're here to see the kittens.
Oh yeah, the kittens are through this way.
Oh, brilliant.
Tara and her family are now also taking care of 10 stray newborn kittens and want to make sure they're all healthy.
The feral cats just congregate here because we leave food outside for our own cats. And most of the feral cats aren't neutered, so that's where the kittens have come from.
Oh, look at Louisa. Oh my God, I'm gonna have so many cuddles. Oh, look at you. Hello.
So Tara, how many cats and kittens have you got inside at the moment?
So we've got 10 kittens here, and we have 10 feral cats outside. And we also have 10 cats of our own.
Oh, wow.
Blimey.
That sounds like a lot of work for you.
It is.
Oh, wow.
It's so wonderful that Tara and her family have taken on these cats and are looking after them so well. It's not the cat's fault that they were born on the street.
Right, time to find the first patient of the day.
Today, Riaz and Gemma will be giving general health checks, including free flea and worm treatments.
She's being such a good girl for this, isn't she? Well, do you want to hold her for me?
Absolutely. Hey, little one.
This one?
When the kittens are older, they'll also be neutered.
And that's the first patient of the day done.
Yeah. Roll on number 2.
Right, let's pop this little one in here. We'll get some friends for you in a second. Just shy of 700 grams, wow.
Hi.
Looking at these cute kittens, Riaz is not convinced Gemma's gloves will ever be needed.
Really strong heart.
Brilliant.
So far, their only problem is remembering which kittens have already been checked.
Gem and I came up with a plan, which is once we had wormed and given each kitten their health check, we'd put them in a box, which was hopefully too big for them to climb out of. Unfortunately, a few of the kittens managed to worm their way out of it. Pardon the pun.
Oh, she's back out.
Oh. We've got a little escape artist, I think, Gem.
It's a disaster, it's not working. They get in, they hop back out again. So we're now trying to pick up and see which ones have been treated or not, and it's not easy. So we've done 9 of the 10 kittens so far, but number 10 is being a little bit more difficult. Come on, get in there, Riaz.
Oh, I can't see a bleeder back here.
I'm going to leave this last one that's being a bit difficult for Riaz.
At last, those gloves may just come in handy.
I heard it hissing, so I just got prepared, but I might need you to give me a hand moving there.
Oh, but I'm having cuddles.
Oh, Gem.
Look.
It's not fair.
So Riaz was very, very grateful of my gloves in the end for feisty kitten number 10.
I think we might actually have to move the washing machine out. Oh, here he comes. Here he comes. Here he comes.
Yes, good catch, Riaz.
Right, Gem, just pop my ears in for me, and sounds fit and healthy.
Let's just worm him first.
Let him go.
Yeah.
That's enough bother for him for one day.
It's great that we get to do a bit to help the community and help these stray animals and help Tara's family, really.
Inspired decision to bring the gauntlets.
I told you we need them. You laughed at me.
I take it all back.
See, now you appreciate my gauntlets.
Yeah, I should never have doubted you.
With the health checks complete, the next step is to find them all new homes.
Leah, our receptionist, is actually looking for a kitten, and I suspect that there might be a little tiny one here for her.
Here we go. Hiya.
Oh, hi. Hi,
Here she
Bella,
is.
darling. Oh,
Here we
pop
go.
it.
At the Richmond Practice, Bella has just recovered from an operation to remove a worrying lump from her face.
Oh, what have you been through?
Foster carer Wendy has only had the 9-year-old bull terrier for a few days, but is already becoming attached.
I've been sort of panicking a bit, worrying, and like you do when your dog's actually in the vets. So I've been treating it as if she is mine, but it really gets to you. Was the lump suspicious at all?
It was a fibrous lump, but very difficult to say if it's malignant or benign at this stage.
Just got to wait for the results then.
You've got to wait for those results.
Yeah, let's keep fingers crossed then.
The question now is whether Wendy will decide to keep Bella.
All right, then, Scott.
Let's hope
Thank
for
you.
some plain
Well, I
sailing
shall
from
hang
now
on
on.
to it anyway until she's fully recuperated, don't worry.
Please
She's
do.
not going anywhere at the
She
moment.
needs your love, Wendy. She needs it.
I know, she's not going anywhere for the moment anyway. Bella, beautiful girl. She is actually part of us already, even though we're just fostering her. And I will treat her over the next few weeks as if she is ours.
Bye, gorgeous girl.
Lovely seeing you, thank you.
It's going to be a tough few days for Wendy as she waits for the results from the lab. But if it does sadly turn out to be cancer, I honestly don't know how Wendy will cope.
Come on then, Bella. Let's get you to the car, Poppet.
In Isleworth,
Oh, Paloma, what are you doing? Are you taking a rest?
boutique owner Laura is hoping Scott can give her very special rescue dog a healthy new life.
She is an absolute beautiful dog, like an Egyptian goddess. And she has such poise and grace. She's just a delight.
This exotic-looking dog is a Podenco from Spain. In their homeland, the breed is often treated with shocking cruelty.
They are not considered pets. They are bred purely for hunting rabbits. They're starved because the perception of the hunter is if the dog is starved, it will hunt better. As soon as the season is off, they dispose of them by either throwing them out on the streets or even worse, they throw them down ravines and unspeakably, they hang them off trees.
Paloma was one of the lucky ones. after she was rescued and taken to a Spanish pound. The Podenco was suffering from a broken leg that had never been treated.
I assume the hunter obviously couldn't care less about her health and just let it sit as is. Once realizing that she couldn't hunt, he dumped her.
The lower joint and the upper joint are not affected, but we've got a twisted leg.
A local vet then refractured and straightened Paloma's leg with a metal plate.
I applied to adopt Paloma. As soon as she arrived at the door, she was just delightful, so happy, loving and jumping, and so glad to be here. And it was just wonderful. Are you a happy girl now that you're here?
Paloma is now settling in well to her new English life, but Laura is worried she may still have a problem with her leg.
Lately, there is a slight limp after she runs quite a bit in the park. We're going home. That's why I've contacted Scott. I wanted him to check her over just to make sure there's nothing very serious. Hello, Scott. How are you?
I'm very good, Laura.
Good to see you.
How's our beautiful Spanish princess? Hola!
Well, here she is.
¿Cómo está?
Having a rest.
Bit tender there. You can see
concerned.
she's saying, in the nicest possible way, get off, aren't you? Hey? So there's definitely a bit of restriction in the movement of her wrist joint, her carpal joint there. It just doesn't quite go back as far as it should. The old fracture site and where the plate is holding the cut together is just here. I can feel it under the skin, and we can see a little rub mark there where there's actually I can feel a screw underneath. Sometimes hardware like this plate has to come out, and sometimes the body wants to get rid of it. Laura's telling me that Paloma's limp is getting worse, and there could be a lot of reasons for that. It could be a complication to do with the plate itself or residual pain from the original injury that she suffered. And the last thing that poor Paloma needs is more surgery, considering the shocking history that she's had. Can we take a few x-rays of you? Thank you. I'm going to take that as a yes. Hey?
Paloma,
Hey?
where are your manners?
Hey, I know. You're a bit of a flirt, aren't you, really?
Oh.
Hey? Are you a bit of a flirt? Yes, is the answer to that. Yeah, me too.
But before heading into the clinic, Laura has another unusual patient for Scott, a hedgehog.
Wow, she's amazing.
This is Polly.
Wow, Polly and Paloma, the oddest of odd couples ever.
Absolutely. I've had her for 2 years. She's blind, and she's part of the family, and it's absolutely delightful.
What's going on with her anyway?
Well, I wonder whether she has a bit of lungworm. She has been wheezing and coughing, so I thought I might as well ask Scott to take a look at her.
Shall we bring your little spiky sis? Should we? Hey, bring your spiky sis to the vet practice.
Yep.
All right, let's go.
Let's go.
Come on, Polly's coming with you. Good girl.
So Scott now has 2 patients to investigate, and they're all getting a lift with him to Richmond. Meanwhile, at the practice, Manager Maz is overseeing a very important event. The old manual X-ray machine is finally being retired.
It's going to make a huge difference having the digital X-ray machine in. It's a lot faster, it's shinier, it takes up a lot less space.
Maz only told me this morning this was happening. I'm really excited for the digital X-ray. I've been asking for one for ages.
Nathan, I'm sure I sent you an email about it.
It looks very tight.
But first, the old model has to make way, and Nathan's been roped in to do the heavy lifting.
I really don't think it's going to go. Like, I'm really sure it won't. Dave, you've got an untied shoelace, so
Yeah, I've seen it. Yeah, thank you. Very kind of you. Give me the back end of it, Nathan.
Nathan does get the dirty jobs, unfortunately. If you've ever seen Scott Miller try and put a shelf up, you'll know why Nathan is the go-to guy for pretty much anything that needs to be done.
Made it.
I told you you would.
I wasn't going to let you down.
But Nathan's busy day is far from over.
I've just got to complete the network connection.
He now needs to assist digital X-ray technician Andrew with the setup of the new machine.
Right, so Nathan, once you've got a solid green light, that means the system is ready for use. What are you going to X-ray?
I think I'm going to try the stethoscope
Oh, we haven't
first.
got an animal.
Oh, sorry.
None here at the moment.
Oh, no. Okay, well, the stethoscope will have to do.
Oh, I'm really looking forward to this, Maz.
Nathan's the kind of guy who plays things quite close to his chest. He doesn't sort of let you know too much when he's kind of happy or angry or anything like that. But I would say without a doubt, the digital X-ray has definitely excited him.
X-ray.
That's it.
But can it live up to all the hype?
God, that quality is amazing. God, look at it. You can literally see everything. Be honest, you're very excited right now, aren't you?
It is like Christmas.
You're such a geek.
I know.
That's insane.
With the X-ray machine up and running, Scott's about to christen it with a real animal, Laura's rescue dog, Paloma.
Here we are.
Come on then, girls. Through we go. Come and say hi to Auntie Em.
Hi, Paloma.
Ah,
Hello, how are you?
there we go. Keep it nice and comfy. Yes, because we're going to sedate you and have a look at that leg, aren't we, sweetheart?
Scott and head nurse Emma want to know what's making Paloma still limp, after a plate was inserted into her leg to fix a fracture.
Let's hope we don't find anything too bad.
I'm just hoping that it's just something that can be fixed with rehab rather than have a major operation again. Oh, Paloma, you're so brave. What a brave girl you are.
Laura adores this dog. She's so protective over her now. I think she just wants her life to be beautiful.
Good girl.
It's quite emotional, actually. I feel very emotional at the moment. Because she just looks so vulnerable.
Okay, ready?
Okay.
But hopefully everything will be fine.
X-ray. Poor Paloma has been through hell and back. She's had major surgery, and now I'm quite fearful that the plate seems like it could have moved, causing some discomfort. And the worst case scenario is that she might have to go through yet another surgery. The detail on that's absolutely useful, isn't it?
That's amazing.
At the Richmond Practice, the new digital X-ray machine is already earning its keep.
What we can see is very clearly where the old fracture was.
Scott and head nurse Emma have taken X-rays of rescue dog Paloma's front leg to work out whether she needs surgery to fix a nasty limp.
So this is where whatever horrible thing had happened to her, that's the damage caused.
The 1-year-old Spanish Podenco broke her leg as a puppy and was abandoned.
And then the Spanish vets had to then basically cut it and twist it and then replate it. And that's what this steel plate is doing here, is just holding that in place.
The question is whether the plate used to repair it has moved and will need to be surgically removed.
Poor girl.
So that's not a particularly attractive fracture site. When I think about everything that Paloma's been through, the terrible neglect and how she coped with what would have been an excruciating injury, it really makes me realise how brave and how dignified this beautiful dog really is.
New owner Laura is anxiously waiting for the results.
Right, so Paloma's doing very well. Emma's just monitoring at the moment, but the x-rays are showing some really good news, actually. The fracture site, although it's not particularly attractive, it's healing, it's doing the job, and the plate is also doing its job, so that's not the problem. But what I have found is that there is some tightness in the ligaments to the foot. During the time that she was injured, the ligaments of her wrists have contracted like that because she lifted her leg off the ground for who knows how long until that healed. And as a result, now she's trying to run normally and have all the flexibility you would normally expect from those ligaments, and it's just not there. So the key treatments that we need to consider is laser therapy. Now, I know that sounds a bit out there, but it can work really well in these cases. So alongside physio, which will increase the flexibility of that joint. Okay, so no surgery needed. That's great news, but there's still a huge amount of work to be done to make sure that Paloma's leg moves freely. But I know she's got an incredible owner in Laura who's very dedicated, very determined to stick to the plan to make sure that her beautiful dog leads a pain-free future. And now we just need to give her a bit of therapy, a bit of love, and I'm sure she's going to come right.
That's a relief.
Yeah.
That's a real big relief.
Yeah.
Hey, big kisses today.
Close by in Isleworth, another of Scott's patients, Astro, is scheduled for his regular eye examination. Owner Louise, an Australian expat, rescued the 13-year-old cat 7 years ago.
Astro's my little mate. He's adorable. I'd do anything for him. So what's going on today, for goodness sake?
Right from the start, Louise knew he was no average house cat.
First started to realise Astro was a little bit strange when I'd let him out. Yes, boy, go for a walk. He'd go off wandering, but he wouldn't come back. And I could never find him. And inevitably, I'd get a phone call saying, your cat is in my house. So I'd have to go around and pick him up. And people just fell in love with him. It's ever so strange.
There's almost nowhere Astro hasn't been in the neighbourhood. He's welcome at the bowls club and the kids' playground. He even gets a seat on the bus.
Come on.
But his favourite haunt is definitely the local pub.
How's Astro today?
Now, though, Louise is worried Astro's exploring days may be numbered. As a kitten, he contracted cat flu, also known as feline herpes. There is no cure, and when the virus flares up, it infects Astro's left eye. The danger is, if the damage continues, Astro may need that eye removed.
I'm worried about what life he will have if he loses his eye. He loves to go out and wander. I don't want anything to hamper that.
Today, Louise is hoping Scott may have a treatment plan to help her famous cat.
It's a good boy, eh?
Okay, so that's Paloma done. So let's have a look at Polly then, shall we?
Back at Richmond,
here,
while
gorgeous.
Paloma the Podenco sleeps off her anaesthetic,
Oh, look at you.
it's time for her prickly housemate Polly to have her turn with the vet.
Isn't she marvellous? Isn't she?
She's adorable, isn't she?
Isn't she?
Owner Laura is concerned the hedgehog may have picked up a lungworm parasite.
I'm just going to see if she'll let me have a listen. Good girl. I might never get this back again. It's absolutely incredible, actually, to hear a hedgehog's heartbeat. But what I can hear is what we call a dry rail, like a...
Wheezing,
Is that what you're hearing?
Yes.
So it wouldn't surprise me if she has a bit of a lungworm burden here. She does, of course, eat slugs in the garden, and slugs in this area are very known to have lungworm.
Right.
So that's how dogs and cats get them as well. Lungworm is a parasite that's spread by slugs and snails, and they're the favourite treat of a hedgehog. Now, normally they're pretty resilient to that sort of parasite, but when they're a little bit unwell, they can be coughing up blood and the parasites and can be life-threatening. So what we're going to give her is this white paste. Whenever I've given it to hedgehogs before, it looks a little bit like when a 2-year-old gets an ice cream for the first time. It's
I
just
can imagine.
So it will be quite a messy thing, but hopefully she'll have some of it and it'll help to knock off those nasty parasites. You're not going to make this easy for me at all, are you? Good girl. It's actually quite useful because she's bitten onto the end of the syringe.
Oh, dear.
So she's let me get that in.
The medication should clear up Polly's lungworm immediately.
Good girl.
As for Paloma, she will soon begin the laser therapy to help get full movement back into her lame leg.
I'm really hopeful that Paloma will make a great recovery and she'll be playing around in the park with all of her friends very soon.
Okay, thank you very, very much.
Good luck with Polly and that medication. That'll be fun.
My little prickly baby. Thank you
ya.
very much.
Bye,
Thank you,
Lara.
Scott. Bye-bye.
Bye, Paloma. Bye, Polly. You know, normally when clients are here, I never want to rush them out the door, but today my mind's elsewhere. There's something downstairs that I really want to spend some special time with.
Hello. Hi.
It feels nice. Very nice. This definitely is veterinary porn. Oh, man. I'd imagine if anyone had heard Emma and I talking and they couldn't see what we were talking to, they'd be concerned. Look at the detail on that.
I want to lick it a little bit.
Oh, need to get a cold shower now. She's pretty sexy. You're a beautiful, beautiful thing.
Good boy. Come on.
In Isleworth, Astro is making his way to the practice
Astro.
with Louise in his wake.
Astro, come on.
It's the normal leisurely trip as the intrepid explorer makes new friends.
You don't get a haircut today. I've had cats all my life, but I've never had one like him.
In you come.
Hey, Astro.
Good boy. Hello, buddy. Whenever we see cats coming into the practice, they come in a cat basket. But never do they stroll in by choice on their own.
Come in and see Scott. He's not that bad.
It's absolutely incredible. Every time Astro comes into the practice, you can't help but smile. This is an extraordinary cat. Good boy. I haven't seen him for a little while, and I must say his eye isn't looking that great today, is it?
It weeps on and off, and that white bit has got larger.
Astro suffers from feline herpes, and each time the virus attacks his left eye, it's doing more and more damage to his vision.
And one thing I noticed is he can't see very far away.
Yeah.
Like, maybe 20 feet. He can't see me.
Yeah, and that's concerning, isn't it, from his outdoor exploits. He needs to see where he's going.
Yeah.
The concern I've got is that the changes that I can see on the surface of his eye might actually impede his independence. Astro needs 20/20 vision to get around the neighbourhood, but right now I'm really worried that he could actually lose his sight. The eye is far from normal.
Oh, Astro.
Today on examination of Astro's eyes, I can see that he has got some ulcers again, which are a little bit sore and of concern, and so I'm going to be treating those. But the good news I can deliver is, with the right management and time, we'll get on top of this corneal ulcer like we have before. But it is looking more and more abnormal. I'm just really concerned that if his vision continues to deteriorate, it makes it more and more difficult for him to keep himself safe.
Do you think he can see out of it?
He can. You know what it'd be like? It would be like if you got your glasses, you took them off, you went, and you put them back on again.
Oh, so
it's like looking through mist. Yeah.
Oh, okay.
Yeah.
For now, Scott will treat Astro's ulcers with antibiotics and continue to monitor him regularly.
Louise, I know how much you love this cat and how much he means to you.
Yeah.
I mean, this cat really is one in a million. He is so special, and he just deserves the best of care. We need to ensure that this guy keeps doing the extraordinary things that he does.
He loves life. He loves it. So I'd like to see him have it at its best.
Well, let's go and get the best for you, shall we?
Get me fixed.
Shall we get the best for you?
So I'm not quite speaking to you yet,
No.
Scott.
Okay.
Almost.
You're a bit mad at me, aren't you?
Yeah.
You're a bit mad.
Come on this way.
Just 2 days after Paloma's x-rays, Laura has not wasted any time organising cutting-edge treatment to ease the stiffness in her Podenco's leg.
Hello, Lara. How are you?
How are you?
How's our girl?
Not bad,
Yeah?
not bad.
Okay, well, now we're going to up the ante a little bit with laser therapy.
Oh, wonderful.
All right, I'll take her off your hands
Thank
and
you
I'll
so
see you
much.
later.
Okay.
Cheers.
Thank
Bye.
you.
Come on,
Thanks a
gorgeous.
lot. Bye-bye.
Good girl. Laser therapy is fantastic for Paloma because it'll help her to break down any scar tissue that might be present in the leg, but at the same time it reduces inflammation, it can reduce pain, and it stimulates cell formation and regeneration. All great things when you've suffered with a chronic injury. Here we go. To Leah. So if you just give her a little hold there.
Receptionist Leah is going to help Scott during the laser session.
It does need 2 people, and those 2 people need some crazy glasses, and Leah was more than happy to try some on.
I think I'm going to go for the middle ones.
Really?
Yes, please.
Surprising. Build a chic.
I know, bigger the better. How do I look?
You look like you're about to do a spot of welding.
Well, I'm a woman of many talents.
I bet you are. All right, I'm going to sort of go for like triathlon style. What do you think?
Excellent, it just worked.
Thank you, Leah. What do you think, Paloma? Do I look like a plank? Hey? Yeah? All right, let's just sort your laser out now, shall we? So what we're going to be doing is just using this little machine, and what we're going to be doing is for about 6 minutes just putting a laser onto her leg.
So can she feel any of that?
She might feel a little bit of tingling, and she might feel a little bit of warmth as well.
Okay.
She don't seem to be bothered by it though, do you, sweetie? Hmm?
You are good. You're being such a good girl. You are. It was my first time seeing the laser machine. I'm actually surprised how sort of gentle it was and didn't really affect Paloma in the slightest. It was really good.
Hopefully what it's going to do, more importantly, is just try and heal and improve any scar tissue that might be present. Just get a little bit more flexibility in this joint so you can run like a gazelle. That's what we want, isn't it?
Hey.
There you go, Paloma. That wasn't too bad, was it? Hey, wasn't too bad. The fashion wasn't bad either. Hey.
Oh, good girl.
9-year-old Bella is settling in beautifully with her foster carer, Wendy.
Everybody falls in love with her when they see her and all want to come up and greet her, which is very unusual with an English Bull Terrier because a lot of people will cross the street from you.
But Scott is dropping by today with some important news that could affect Bella's future adoption. 4 days ago, he removed a lump from the Bull Terrier's face, and Wendy is hoping the test results will rule out cancer.
Well, that scar looks beautiful, Wendy. I'm happy with that.
It looks great, actually.
So, it's a mixed bag of news regarding the lump.
Right.
Okay. So, what do you want to hear, the good or the bad?
Bad, please.
Okay. It is a malignant, a nasty type of tumour. Okay. It's called a sarcoma.
Right.
But thankfully, with sarcomas, they're graded on a spectrum from not too bad to dreadful.
Right.
Luckily, hers is a grade 1, so it's a not too bad type of tumour.
Okay.
But the good news is that the surgery was able to remove the tumour completely, and the pathologists have told me that the chances of it returning are very low.
Brilliant.
Right.
That's good news. That's really good news.
Yeah.
Isn't that good, Bella? That's good.
You happy with that? So it's great news for Bella. It proves that she is now cancer-free. She hopefully can live a long, full life.
And finally, Wendy has made up her mind about adopting Bella.
I think you talked us into keeping her.
That's amazing.
So, yeah.
That's so good, because I tell you what, it was dangerous. If you didn't take her, I think I might have had to.
I knew you would, and I thought he's not having her.
Oh, that's wonderful news. I'm so happy for you, and I'm so happy for her. I think you're going to make an absolutely beautiful team.
Hope so.
And I know that you're going to give her the lovely life she deserves for however long you have her for.
It was just like it was meant to be. It's just like it was meant to be. It's like she's been sent to us. We've got to keep her because we just love her. Go find it. Good girl.
It brings me so much joy to be involved in something like this where I can actually help an owner and a dog find their match. It's absolutely the ending that this dog deserves.
Good girl.
What are you doing? You can't jump up here. You can't.
3 weeks later, Isleworth receptionist Leah has brought along a new assistant.
It's been very difficult trying to keep an eye on her while I'm trying to work. She's been climbing over the keyboard. She's in one place, turn around, she's in another place. Are you helping?
The curious kitten is one of the 10 strays that were recently health checked by Riaz and Gemma.
Hi. She's a very adventurous kitten. She's climbing, exploring, very, very nosy. When I heard about this kitten from Gemma, I knew I had the perfect home for her.
Has Auntie Lily got a surprise for you?
Leah's sister Sam and 2-year-old niece Delilah have just arrived to meet their new family member.
Hello. Look.
Who's that, Dee?
Delilah, look what I've got. Okay. Look.
Is that your new cat?
Yeah. Do you love her?
She's so gorgeous.
I know, she's so cute, isn't she?
Leah's made Delilah so happy today. I know she's going to be over me with the new kitten.
What are you going to call her, Delilah? Shira? That's a pretty name. Delilah has decided to name the kitten after one of her favourite cartoon characters, so her name is now Shira. Do you love her? Yeah, you do. Oh, thank you. Oh, thank you. Is she getting you hairy? Yeah. Are you brushing it off? You don't want to ruin your outfit. Brush it off.
Oh, I love
her. Have you got 2 cats now? Shh, don't tell anyone.
So it's the last cat we're getting, yeah?
That's one more to the collection. Have fun.
Say thank you to Lily.
You're welcome, Dee Dee. I'm so happy that this kitten is going to Sam and Delilah because I know they're just going to give her the best life. She really has gone to a great home.
Gently.
Good girl.
And what would you like to drink today, huh? Milkshake, maybe?
There's also good news for another
nice
cat.
cocktail.
Isleworth icon Astro.
Great news for Astro is with all the medication that we've been using, his herpes condition is now under control and his vision for now seems improved. So for Louise, it means she can be confident, he can roam around his neighbourhood, and long may the king of Isleworth reign.
As long as the cat doesn't creep down in the night and help himself to my beer.
You like a drink, don't you, Astro? I'm looking after him. He looks after me. He means the world to me.
Oh, it's not a thing you see every day, is it? Cats walking around in pubs. That's what he does. That's true. On another planet.
Yeah.
Come on.
Hi, Laura. Good to see you.
And you. Mwah.
Hello, beautiful Paloma. Ignoring me.
She's too busy having fun.
As for Paloma, after weeks of laser treatment and physio, the Podenco's leg is much improved.
She does really seem to be walking brilliantly well.
Oh, yeah, totally. She runs. I haven't seen a limb.
Paloma's looking fantastic. She seems so comfortable. She seems to be running so beautifully well. And it does seem that all the hard work that Laura has put in with regards to the physiotherapy alongside the laser has really made a difference.
Yeah, absolutely. Good. She's loving life. Has lots of friends and she loves the park so much. It's hard for me to get her to come home.
Hello, baby. Hello, gorgeous. Good girl.
Paloma is very grateful to have been saved, and she shows me every day through love, affection, and sometimes mischievousness, but that means that she's feeling at home and safe. And obviously that makes me very happy.
I really admire Laura's passion for animal justice. When she heard about the plight of Spanish Podencos, she didn't just stand by, she did something to help. This woman is a real rescue warrior, and I feel privileged to be able to have helped her with her cause. Well, Laura, I'm so proud of what you've managed to achieve with this dog, and she's looking great, she's running well, she's got lots of friends, and she's got a loving owner, so what else can we ask for?
And I'm proud of you.
Oh, well, thank you. Let's hug it out.
Oh.
It says it, doesn't it?
Well, I think it's got to say it today.
Be calm. Who's that for?
Well, it's for you, really.
It's for our lovely Digby that's coming to see us today.
In Isleworth, southwest London, Scott, nurse Nathan and receptionist Elle are putting up a brave front as they prepare to meet a new patient.
And do I get any danger money for this?
Nothing to worry about at all, Nathan.
Teddy bear.
Teddy bear.
Don't worry about it, Nate. Here we go. They're looking nervous. I'll hold up the sign.
Hello. Hi.
Mother and daughter Sharon and Amy have already warned them about the intimidating behaviour of their 6-year-old Rottweiler, Digby. The problem is the Rottweiler has now developed a mass in his chest.
Good boy.
Owner Sharon knew she had to find a vet who would take a risk.
Digby at home is an absolute softie. He is sweet, he's affectionate, and he loves a cuddle. But take him out anywhere to meet any other dog or anybody else but the immediate family, and that 50 kilograms of love turns into 50 kilograms of raw aggression.
To ensure the safety of his staff, Scott has decided to be the only stranger in the consultation room. Even the camera crew must film from outside.
Sharon, why don't you jump on that side?
Yeah.
There you go.
Digby hasn't seen a vet for quite a few years, and the last vet he saw didn't know what to do. He was nervous of him, but luckily we found Scott.
Sit down. No. Sharon came in to see me after she saw Bam Bam and the way that I treated him in the first series of Vet on the Hill. Calm down.
But there's a massive difference between the feisty Bam Bam and the all-powerful 110-pound Digby.
Whoa. It's okay. All right, settle down. I'm not doing anything. I'm not going anywhere. A lot of people would say straight away, that's an aggressive dog, it should be put down. And I understand that. But the situation here is that they got a dog that was friendly and happy and healthy as a puppy. It has grown up to be aggressive, and it's aggressive for one reason, because it's fearful. It is not innately evil. This dog is a friendly dog that it gets scared, and he gets scared and then he gets aggressive. Okay. All right, I know. It's a little forward, wasn't it, mate?
We always make sure for him we put a muzzle on and he's safe when he goes out. It's just being responsible, really.
I'm trying to rush this relationship, which is never a good idea, is it? Okay.
Because when we take him out, you get people that stare, and they do make some nasty comments. Why don't you put that dog down? Yeah. It makes me angry. No, we never ever put him down. We love him to bits. But we've had him as a puppy. We've shown no aggression to him whatsoever. So it was inbred from the mother. He's come out on him. All right, stop it.
As Digby remains alert and agitated, Scott's still a long way from being able to examine the lump on the Rottweiler's chest.
Soppy old thing, aren't you, eh?
This job sometimes throws curveballs, and aggressive dogs come in, aggressive cats come in, and you've got to treat them, you've got to deal with them, so you've got to find a way to make it work. All right, all right, all right, all right. Right.
3 miles away in Richmond.
What are you saying? Doesn't hurt, does it, Belle, when I touch your tail? Eh? Does it?
Another of Scott's patients is also in need of help.
That, don't you?
Owner Kathy is growing increasingly concerned about her 2-year-old cat's broken tail.
Oh, your poor tail.
The nasty injury happened while Bella was being cared for by a family friend.
We were actually on a yacht off the coast of Corsica when it happened, and I got a call from Scott's practice to say that she had obviously suffered major trauma to her tail. I don't know, I was in shock really, because you don't really expect to be hearing that sort of news. It's been a bit sad to see her tail now just drooping down off the back of her body. She can move it a little bit. She does have a bit of control, but not very much. I know, Bella. It's annoying, isn't it, that I'm standing by the door and you can't open it. What?
So, with no sign of improvement, it's meant Bella and her brother, Mr. Lucky, have been confined to barracks.
You think that can stop me? It's probably your curiosity that got you into this scrape with your tail, wasn't it, Bella? But we'll never know, will we? Okay, come on then, Belle. Come on then. In you go. Good girl. Right, there you go.
Now it's time to head off to see Scott to find out if Bella's tail can be saved.
Okay, Belle, make yourself comfortable because now we're off, okay? Big adventure, Belle. Come on then.
I know.
At Isleworth, Scott's slowly trying to calm down the aggressive Digby so he can examine a mass on his chest.
So, Amy, tell me about the lump. Like, when did you first find it?
I think it was about 3 or 4 months ago.
Yeah.
Ever since I've been trying to find a vet.
Owners Sharon and Amy have not dared take the Rottweiler to a vet since their last visit years ago ended badly.
He was very nervous, moving his arms around. He couldn't get up close to Digby, and when he did, he spoke, and then Digby went berserk.
Oh, he's a good, brave boy.
After 30 minutes in the consultation room, Scott makes his first attempt to feel Digby's chest.
Oh, it'll give you a bit of a tickle there, hey? Hey? Oh. Okay, all right, I know. I'm not trying to win the argument straight away. I know, I'm sorry. The whole time, he's lunging at me, I'm just telling myself, be calm, don't react, don't move, stay still. Oh. All right. Am I scared? Are you kidding? I'm bricking it. 50 kilograms of raw muscle power coming at you with bared teeth and growling. And every instinct is saying, keep your distance. But then I look at Sharon and Amy and I see their faces just literally saying, please help us. You are our last chance.
After another 20 minutes, a breakthrough.
Do you know what I can see with him? Is I can really see that he is actually a sweetheart. I can see that.
Scott finally appears to be gaining Digby's trust.
You're trying to be aggro, but I can see you're sweet and lovely, really, aren't you? And look what you're letting me do. Oh, he's a sweet boy. Oh, he's a sweet boy.
I mean, the good thing with Scott was that he did remain calm and he didn't have eye contact and he did manage to stroke Digby, which no stranger has ever done. I couldn't believe it, really.
I'm just using some acupuncture points as well. There's one on the tip of his ears that just chills him out a little bit. Oh, he's nice. Oh, I feel very honoured. I must say that when I was finally able to touch Digby for the first time, it was exhilarating. I mean, it was like touching a wild animal. And to give him a little scratch under the chin, honestly, it gave me goosebumps. It was amazing. What a handsome big pussycat. Eh? Big 50-kilogram, big teeth pussycat.
Good boy.
Yeah. It was lovely having the love-in with Digby, but it was always going to end. And it was going to end in the form of a sharp needle in his butt. Do you want to put him into this corner maybe and then he can't push back? And that was never going to bring out his happy side. I went from hero to zero, but sadly it needed to be done to knock him out, but he wasn't impressed. Done. All right, I'm definitely a swear word that I can't say, aren't I, mate?
But with Digby's adrenaline pumping out of control, the huge quantity of sedation is not enough. And Digby is still a threat.
It was incredible to see just how much drugs this dog took. He was like a rogue elephant. It's all right. Nice sleepy time now.
No, I'm sort of excited and nervous. Very
nervous.
At St Margaret's in southwest London, Scott's practice manager Maz and his wife Zoe are on a very important house call.
Hey guys!
Zoe and Maz are also sisters and here to adopt two puppies, a boy and a girl.
Come on, puppy. Okay, you better come in before they come out.
It's an emotional day for the puppy's mother Bonnie and Bonnie's owner Sophie.
You've caught them in a more active state now.
Who helped Scott bring the 6 puppies into the world after an emergency cesarean section.
And what you're going to do is you're going to rub it really firmly on the chest, okay, really firmly and stimulate.
I've never done anything so terrifying in my life.
6 breathing puppy!
Hey, good job, well done. Hello, gorgeous.
With such an unexpectedly large litter, Scott decided the Millers would add another member to their family.
What's going on down there? Oh, I just wanted to go.
I think a part of Bonnie is ready to let them go now.
Oh, really?
Yeah, they're quite rough and tumble around her. So you've come to save the day.
This one?
This one is yours, I think.
Oh, hello, darling. What are you waiting for? Baby, hello, baby, hello. Oh, hello.
Maz was completely in love with her puppy from the second she saw him. Because there was this real sort of nose-to-nose sort of kissing, licking moment. It was like, get a room, guys. So, yeah, it was very, very cute.
You having a little sleep? It's my kind of puppy. Likes an afternoon nap.
I'll miss them so much. I'll miss them so much. I'll just miss their little bodies. Their funny hoppity-skippity running across the kitchen. They're just so naturally happy. It's amazing.
Hey, bye, Mama.
Right.
Bye,
Mama.
Bye, Mama. Thanks, Mama.
Bye, darling. Bye, darling.
Thank you, Auntie Sophie.
Have a lovely life.
We promise we'll look after them, Bonnie, OK? We'll love them very much, just as you've done. Yeah, we will.
She's checking them over.
Oh, I promise.
Can I say bye-bye? Bye-bye, Mummy.
They're going, Bonnie. It is quite hard to hold her and see her watching them go out of the house.
Bye, Bonnie. Come on, little
They're
girl.
going now, Bonnie.
Not only are the puppies leaving their mum today, they're also being separated for the very first time.
Yes. Say bye-bye.
See you soon.
Bye, broski. See you soon.
Bye-bye.
Bye-bye.
Zoe's now taking her pup home to a very excited family.
Walking through the door with the puppy is going to be unbelievable. The girls know the puppy's coming home today, so I'm going to have to make sure we dial down the crazy slightly as I walk in the house to make sure the puppy doesn't go, no thanks, I'm out of here.
There's some people waiting to see you.
Just a couple of miles away in Isleworth, Scott is attempting to examine a suspicious lump on Digby's chest. But despite sedation, the huge 110-pound Rottweiler is still putting up a fight.
Today is all about getting to grips with the lump and actually just removing it. Normally there'd be a whole bunch of steps and examinations that we do prior to this kind of surgery. That's just not an option with Digby. So what I need to do today is to knock him out. I need to remove the lump and hopefully send them home with good news. All this activity will actually make him go down in a second. He's more likely to crash and sleep. Now he's energized himself, blood supply is flowing, those drugs will kick in a little more. So after 2 injections of sedation, which would have been enough to knock out a rhino, he finally is calm enough that I can get an IV anaesthetic into him. 1, 2, 3. Good boy. Now we've got to get him down the stairs, and I'm walking down thinking, this better not be cancer. Not only because it's dreadful news for any owner, but from Digby's point of view, how the hell am I ever going to treat this dog if it is cancer? So fingers crossed it comes out as something not to worry about.
Oh yeah, I can feel it now, yeah. It's quite a decent size.
Yeah, it's a big one and getting bigger. Okay, let's get going. Okay, so let's see what this nasty little thing has in store for us. So now I'm just going underneath, just see what I find. There we go. It's not looking too bad to me. If I cut through the middle. Nath, that looks a hell of a lot like fat. Nice, healthy, white, glistening fat. So that means there's almost certainly to be a lipoma. Nothing to worry about, which is great news for Digby. Mate, you don't need any more vets, do you? No. Straight away, I think Sharon and Amy are going to be over the moon. They're going to be so happy. I mean, this is their boy, this is their love. And the fact that this is one surgery that we can perform, we can fix the problem straight away, and he potentially doesn't need to come back and see me, is good news. Okay, good boy, that's it. All done.
Digby will now sleep off his anaesthetic in the recovery room, but Scott remains wary.
Right, he woke up very quickly, and I'm going to exit.
Upstairs, Sharon and Amy are waiting for the verdict.
Hi, guys.
Hi, Scott.
So, you look very expectant and very worried, but in fact, it's all good news. It looks like a fatty growth, which is called lipoma, which is really good news. I should be seeing smiles. Should be seeing smiles. You happy?
It is good news.
It is good news, isn't it?
I'm glad.
It's nothing to worry about. I've put stitches that don't need to be removed. So literally, it's a case of taking him home and hopefully living a happy and healthy life.
I'm glad. I was worried here. I thought it would be something more serious.
Yeah. But I can see he's definitely got a kind heart in there. He's just quite misunderstood. He's a lovely dog.
He's fantastic at home.
Remember about him?
But I'm just really glad that I've been able to hand back your beloved dog with my 2 hands intact. That's quite nice.
That's a plus side.
And without a lump on his chest.
Yeah. It means a lot for what you've done. There's no other vet that would actually see him.
Oh, thank you. That's very kind. Thanks very much.
You're perfect. You're a perfect vet.
Oh, thank you. That's so sweet. Oh, thanks. Well, that honestly means a lot. Got me choked up a bit there. Lovely, thank you. No, I don't think I'm anything special. I'm literally just a vet doing his job, but I'm glad that she was happy. All right, so he's just through here.
Scott's going to feel even happier when Digby's on his feet and walking out the front door.
Digby, baby. Digby, sweetheart.
But he's definitely leaving that assignment to the immediate family.
You got a softie, really.
I think many people might find the fact that I treated Digby controversial. People might say that I shouldn't have given him any treatment at all. He's aggressive and he should have been put down. Good job. All right, ladies. Well, I would say to those people that he is a much-loved member of Sharon's family. They adore him, but they know that he's got problems and they've put steps in place to ensure that he's safe and everyone else around him is safe also. So I would say to them, I'll look after Digby and you look after your own dog. All the best. Bye, diggers. Oh, man.
Good boy.
That'll take it out of a vet, that will. Jeez. Oof.
Oh, good boy, good boy. Come on.
How do you feel things have been going?
She's been her usual demanding cat with attitude self, jumping all over the furniture.
At Richmond, it's time for Scott to decide the fate of Bella's fractured tail.
What kind of movement have you seen, if any?
Well, she does, the last 2 or 3 days, I have noticed she can lift it a bit, then it falls down.
The 2-year-old cat broke it while owner Kathy was away on holidays.
We've still got a very floppy tail, haven't we? To actually dislocate a tail, pull 2 vertebrae apart, that would have really hurt and would have been done at quite some velocity. So generally it's a cat that's run, got caught in something, been run over, kept running, and the tail dislocates. What I'm going to do is just do a quick deep pain test.
Scott's checking the tail one final time for any signs that it can be saved.
I'm digging my fingernail in there and there's not the greatest of response there. It should be really quite painful. And the fact that she isn't would suggest that there's a level of nerve loss or nerve damage. This tail, being that it's not being positioned properly, can be caught indoors, can be caught on fences, can be caught up trees. If she has a good tug on that again, it can go from a significant injury to an absolute nightmare. I do think in this instance that it is probably the best option to consider amputating the tail.
So your poor Belle. If we don't take it off, every time she goes out, I'll probably always be worried that something's going to happen to it and happen to her because she can't control it.
So that's exactly where we'll take it off from that point.
Right.
The risks of doing this procedure are that as there is a huge amount of nerves at the base of the tail there, you can damage their ability to do things like control anal tone. So it might be, in worst case scenario, that she becomes incontinent. That's the worst case scenario.
I think, we've just got to do it, really. Not doing it, to me, doesn't seem like a serious option. Yeah. So you're poor little Belle. But you're going to be fine, aren't you, Belle? Because you're a tough girl, aren't you?
Tough cookie.
Yeah.
Sure.
Bella will now be admitted to the clinic. Her momentous surgery is scheduled for tomorrow.
It's funny, she's quite comfortable. Normally, she doesn't like to be held, by someone who's decided to hold her. She doesn't mind if she's decided.
I know. You're being affectionate to the guy about to take your tail off. Not a great choice.
Well.
At least she obviously trusts me, which is nice, isn't it? Right?
the Miller household, Scott has finally managed to get away from work and is now trying to keep his two little girls, Summer and Quinn, under control. They've been counting down the hours to meet their new puppy.
Where's the puppy? I've been waiting for you!
I know, well, look who I brought.
Hey!
Oh, it's our little puppy.
The girls are so excited. They're so happy to see her. She's such a friendly, happy little thing, and I just know she's going to be so well loved.
It's so cuddly.
I know, I think she likes
cool.
it. She is cool, she is
Very cool.
What are we going to call her?
My kids are never short on ideas or words, and the list of names that they came up with was fairly comprehensive.
How about Skull Crusher?
Oh, that's a good name for a little white fluffy dog.
I am not yelling Skull Crusher across the
It does toughen her up for a bit.
I'll vote Scully. Okay,
Scully?
I'll vote Scully.
Scully it is.
Yay!
But now the moment Scott's been worried about.
Let's introduce him to Betty. Yes.
His 10-year-old Border Terrier, Betty, is still recovering from spinal surgery. He's concerned she will feel displaced by the new arrival.
Betty, this is your new little sister.
Betty is my little girl. She's my baby. I had her before I was married, before I met Zoe, before we had the kids. So I need to make sure that she is looked after and that she isn't going to be too upset by this. And she is a social dog. She does like other dogs. And I have a feeling that this little one will bring a little bit of spark back to my beautiful dog. Yeah, it's a beautiful, comfy bed you've made, isn't it?
Yeah.
After such a big day leaving her mum and siblings, it's time for Scully to settle in for the night.
Here you go, babe. I just grabbed it out of the car.
Nice.
So to make sure it doesn't feel too foreign to her, we got the blanket that she's going to be sleeping with and rubbed it all over Bonnie, the mum dog. Still feeding.
Smells like her.
Doesn't it?
Perfect.
Aw. Fingers crossed, she's going to at least feel a little reassured. I think this is one very tired little monkey.
Go on, Skullston.
I have complete dread when it comes to crate trading this puppy. Betty was an absolute nightmare and screamed like a banshee for about 5 days. Hey, what do you think of your new little sister? Hey, isn't she gorgeous? But it was certainly a very good introduction into parenthood. So we are used to getting up early. I can't look any more tired. All right, let's let her have a rest. It's the first morning, and our little lady here is settling in quite well.
Next day at the Miller's house, the newest family member, Scully, is proving to be a perfect baby. Every moment of the puppy's life is being captured on home video.
Amazingly enough, Scully was completely silent all night. So often puppies show a level of separation anxiety when they go to their new home for the first time, and that's why the first night can be quite monumental in all the bad ways. They can cry for hours on end, they can sort of scratch at the cage, they can even injure themselves if they get upset enough. Just the fact that we'd had a good night's sleep without another thing waking us up in the middle of the night was incredible.
She's so clever.
And everyone in the whole family, including Scully, is getting on brilliantly.
My name's Scully.
She was a very good girl, Quinn. Did you know that? The kids seem to absolutely adore her already. The cat hasn't eaten her, and nor has the dog. So far, perfect puppy.
Here she is.
Hello, Bella. You're being feisty. Hey.
There's a busy day ahead for Scott. Nurse Gina is bringing in his first patient, 2-year-old Bella.
Look at the eyes on it, hey? Amazing.
The intrepid cat ran into trouble recently, breaking her tail.
Take that beautiful tail away, but it's just floating in the breeze now. It's just an accident waiting to happen, so definitely the right thing to do to remove it. Doing a surgery like this on a beautiful cat, it is heartbreaking. When you have to change their appearance forever is a real shame, but she will continue to be beautiful even when the tail's gone.
So brave.
But the cosmetic change in Bella is the least of Scott's concerns about the amputation.
This surgical case is a difficult one because the dislocation is just so high up Bella's tail that it's so close to a little bottom, and there's a huge amount of nerves around that area. And if you cut the wrong one, you can stop her feeling that back end area, and you can lead to lots of problems, incontinence being one of them, and that's the last thing we need with Bella. And bloody close to this poor little girl's bottom. All right, so we'll start now. I actually have to sever a part of the spinal cord, the bit that goes down into her tail. Obviously a nervous moment. You want to be damn sure that you're in the right position. I know the heartbreak of this type of injury and when it goes badly. I had a cat through university that had a tail pull injury, and sadly after 2 weeks he was unable to control his bladder and his bowels, and he did have to get put to sleep. So there's a huge amount of nerves, there's a huge amount of risk, and I've got a few nerves as well. There we go.
There we go. It's off.
Yeah, sorry, sweetie. Right, let's get this closed up now, shall we?
Scott's pleased with the surgery, but he won't know for a few hours yet whether Bella has sustained any nerve damage that will affect her bowel or bladder function.
Kathy tells me that Bella is quite the fighter. I feel that that tenacity is really going to help get her through and go on to live a happy life.
Beautiful. Even with the little tongue.
Morning, Marianne. Morning, chaps. How are you?
Hello, doggies. How you doing? You all right?
All right. Do you want to come in the consult room? We'll have a chat.
Upstairs, lawn bowls enthusiast Marion has cancelled today's game to bring in her 2 King Charles Cavalier Spaniels, Harry and Toby.
1, 2, 3.
Hello, aren't you a happy boy?
It's 9-year-old Toby that's worrying his owner.
So obviously normally a very happy boy, I can see by that waggy tail, but tell me what's been worrying you. That.
That. Yes, he does that. He bites the back foot and he really scratches on under the ear.
Okay. Have you noticed over weeks, months, years that that's actually got more and more frequent?
Yes, particularly the last couple of months. He's been waking me up in the morning crying out.
Very quickly I can see in this consult that everything is pointing towards Toby having syringomyelia. Basically, their skull is too small for their brain. That brain gets pressurized, fluid then accumulates at the base of the brain in sort of cyst form. And as the disease develops, it does irreparably damage the spinal cord. They can become weak and even paralyzed. It's a condition that we see a lot of in this beautiful breed.
Yes.
Oh, buddy. I can see the pain that this diagnosis is causing Marion, and it's absolutely gut-wrenching.
Everybody loves Toby.
Oh,
that's all right.
I know.
He's been with me too long, haven't you?
All right.
It's getting a bit much, isn't it? Eh? There you go. All right? All right, you're a good boy. Have a cuddle. I can't brush it under the carpet. I have to face up to it and deal with it the best way for Toby.
What we need to do is to diagnose it effectively. And the best way to do that is with an MRI. And from that, we can see how bad his syringomyelia is.
Well, we've had 9.5 good years. We're going to have another 4, I think. There you go.
Yeah, it's very upsetting. You know, I hear you say you want him to last 4 years. And honestly, it breaks my heart to think that he probably won't.
Yeah. But you won't suffer because your mum won't let you.
Marion will now take Toby to the Royal Veterinary College. Even if the MRI confirms Scott's diagnosis, he's not about to give up on the little spaniel.
If it does turn out to be syringomyelia, then the outcomes can vary so much. And sometimes, not every time, but with the right medication, they can live a fairly full and comfortable life. I'm not going to let you guys down. All the best.
Thank you very much. Thank you.
All right, I'll be in touch. Bye, chaps. Off you go.
All
Get
done.
to escape the vet now.
There you
See ya.
Bye.
Bye.
At the Royal Veterinary College, Marion's King Charles Cavalier Toby is still air-scratching uncontrollably as they wait for his appointment.
Oh, steady, 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 steady. Come on. There you go.
The friendly spaniel needs an MRI to determine whether he has the painful disease syringomyelia. It's a condition where the skull is too small for the brain, causing fluid to leak out and form cysts in the spinal cord, which can result in irreparable damage.
It's very daunting coming here today with Toby because you know you're going to find out what is the matter. Reality is going to set in.
But Marion is still hoping for a good outcome from the MRI today. Her Cavaliers are a special link to her beloved daughter Jane, who died suddenly from a liver disease when she was just 29 years old.
Once I was really low and I'm sat there, the tears are coming down, the dog just got on my lap and he's licking the tears from my face. And in the end, you have to laugh. They get you out of that down moment. So, yes, they mean the world to me. They really do.
How is Toby today? Good?
He's good, yes, but he's doing plenty of that scratching and what have you, you know.
The RVC's Professor of Neurosurgery, Holger Volk, will be supervising Toby's MRI today.
And you've already met another friend?
Absolutely. Look, he just can't wait, look.
Would you mind coming with us?
Yes, that's lovely, thank you.
Final year vet student Madison is assisting Holger.
Bye-bye. I'm nervous. Anything can happen. But I just feel that he's in the safest hands with all the experts.
There you go, sweetheart.
We have to find out. I haven't got a choice.
The MRI uses an extremely powerful magnet to generate images of the body. It's the most sophisticated diagnostic tool for neurosurgeons to evaluate problems with the brain and spinal cord.
It's quite difficult to win a war if you don't know who your enemy is. And that's actually one of the most important things for us as owners, and I'm a pet owner myself, to understand what you're tackling. You can see that there's a lot of fluid within the spinal cord, and that causes the clinical signs he shows, you know, the scratching, the yelping. It's a very classic presentation. So now we have to just find the right treatment for Toby.
Holger will now give Toby's anxious owner Marion the news.
Actually, what we thought, that's what Toby has. So he definitely has syringomyelia. Saying that, what is really important is that we treat him and not the image. So even if there looks like to be quite a bit of fluid within the spinal cord, he still walks around quite well. So we just have to fine-tune together with Scott the right medication. We will most likely not eliminate completely this clinical signs, but we will find a way to make, you know, those days when he's not so well a little bit better, and he can have then hopefully a very normal life. And as long the other friend, his brother, is not making his life sometimes a bit more challenging, he will be fine.
I feel quite relieved, actually. You know, yes, it's positive and, you know, it's not all doom and gloom.
No. One of the most important things for us as humans is to know what we face, right?
Yes.
Now we know what you know, Toby has syringomyelia, and now we can actually tackle that.
I'm sad that he's affected, but I'm glad I'm getting the answers. If you have the knowledge, you then know the next steps you've got to take. And the important thing is so that Toby doesn't suffer.
All
right, baby? All right? Hey, what happened?
The beauty on being a vet is actually quite simple, is you can care for animals and you can care for people.
There you go, Toby. We've seen inside your head.
And he definitely does have a little brain, doesn't he?
That's
A
lovely.
beautiful little brain.
Yes, clever like your mum, are you?
And I'm never sure what is the most important, but the beauty is that you can combine those two, and that makes it very special.
It's time to go home. Come on. Here we go.
Under Scott's supervision, Toby's new drug regime will begin immediately. The spaniel will require constant checkups to make sure the disease and his pain are under control.
There you go. There's a nice iris there. Do you fancy watering that one in? There you go. Well done. There you go. Come on.
Hello, sweetheart. How are you feeling today? I know you're not happy about that collar, are you? I know.
At the Richmond Hill practice, Nurse Emma has her hands full with feisty tail amputee Bella.
Bella, now, that's not going to work, my friend. Can we leave the collar in place for 30 seconds?
The 2-year-old is recovering well from her big operation.
She's eating, she's drinking, her vitals are all within normal limits, everything that we'd expect.
During the surgery, Scott had to cut through a small part of Bella's spinal cord. The danger was if she sustained any nerve damage, it could have made her incontinent.
I apologise, we took your tail, we're taking your dignity slightly. Good girl, good girl.
So everybody's been waiting for the evidence that Bella can toilet normally.
She's had a poo, which in the nursing world is thumbs up.
And that means Bella is free to go home with her relieved owner, Kathy.
Hey, Kathy, how you doing?
Scott.
You're right.
Yes, I'm fine. How are you?
Good, good. Yes, very well. And so's your girl. She's just through in the consult room, so follow me through.
Hi, Belle. It's been a big adventure, hasn't it, Belle? Okay.
So this is her new look back end.
Oh my gosh, that looks great, doesn't it?
So
It doesn't even look like she's had surgery. So I was really amazed, very pleasantly so, to see that it all looks so good. I mean, it looks like it was done, a couple of weeks ago.
But I still think her name applies, and that although she doesn't have a tail, she's still Bella. She's still beautiful.
She is, yeah.
And
But
I'm sure
she looks great.
I'm glad that you're happy with it, because it's a strange looking back end.
But I mean, her fur will grow back, won't it?
The fur will grow back.
Yeah.
And certainly from this cat's point of view, she's a feisty little madam, aren't she?
She is.
And you're going to be absolutely fine, aren't you?
Yeah.
Yes, she is. Get me out of here before they take anything else off. I absolutely feel like we've all made the right decision. Not only does Bella seem more comfortable now the tail's gone, but it means that her future is secured, and now she can go out and about and enjoy the great outdoors yet again.
We're all going to be happy. Thank you very much.
My pleasure. All right. And Kathy can be sitting resplendent on her couch, sipping a nice cup of tea without a worry in the world.
Come on, Bella. You can go out again. Yeah.
And 1 month later, a confident Bella is indeed back patrolling the neighbourhood.
Come on, Bella.
Without the hazard of her broken tail, she's now safe to roam as she pleases.
She's just loving it, and she's just, her confidence, hasn't taken a dent at all. There you go, back in one of your favourite places, aren't you? She's always been a small cat with a big attitude, and she's exactly the same. I've no regrets at all, and I think if any other cat owner was in a similar situation, I don't think they'd have to worry about it. It's just nice to see them going off and having adventures. But it's nice to see them coming back safely as well. Hey, Belle. Hey?
This is for Toby. All right, this is for Toby. Sit.
It's also been 4 weeks since Toby was diagnosed with syringomyelia.
There you go. Very good boy. Who's this?
And Scott's dropping in to find out if the Spaniel's new medication regime is working.
So how have things been going?
It's so good. And to be honest, he takes his medicine as good as gold. Doesn't matter what you do to him, he doesn't complain. You know, he's just a beautiful dog.
What I can see with him is that he's not scratching anywhere near as much as he was. And that's a very positive thing. He seems very responsive. You seem very reactive, don't you? You're happy for me to be here to see you?
Absolutely.
And I think that's what we need to harness. We need to make sure that your dog is happy and healthy every day. It seems to me that Toby is still living a full and, well, happy life. And all we need to do is accept that some days are going to be bad days and he's not going to be as comfortable. But as long as the good outweigh the bad, he's going to be able to live for a good deal longer. There are some tough decisions ahead. But in the meantime, let's enjoy what a fantastic dog he is. And how lucky he is to have such a wonderful woman like you by his side. What do you think about that? We're just going to make you as happy and healthy for as long as we can. Yeah?
I feel I'm in safe hands. I've made that step to make the quality of his life better. To be honest, you can't do any more, can you? You can come and watch your mum play bowls. Come on then. All right, come on then.
And to thank Scott for his help, Marion's decided to share with him the other love of her life, lawn bowls.
Can I welcome you to Ashford, Scott, and
thank you.
Have a challenge.
Challenge accepted. Marion is quite the gun when it comes to bowls, and I am quite competitive. All right, these feel like lucky bowls.
Grab your weapon and put those bowls on the green.
Okay. I'm really looking forward to this. I've been the expert up to now with the veterinary stuff, and now it's time for her turn to shine.
Bend your knees and you just step forward.
Oh, bloomin' heck. Oh, Marion, you're a gun. Wish me luck? Yeah? Wish me luck?
Wow, you've got a very nice action there.
Thank you very much. Absolutely rubbish. The last few weeks have been really tough on Marion. There's been lots of medical appointments, lots of uncertainty, and lots of sadness. But what's really lovely is to see her, Toby, and even little Harry enjoying their time at the bowling green, just having some precious moments together, because honestly, that is the best medicine of all.
Let's come and have a look and see.
See how I've gone in my first bowls match ever?
Absolutely. Well, there you go. You've got the shot.
Unbelievably, I've won. I don't know how I've done it. Well, I do. It's called beginner's luck. Marion is such a great player. She's such a great lady, and it's been a fantastic day out. Mwah. Bless you, Marion.
I suppose you'll be expecting a trophy.
Of course.
Until Nurse Gemma rushes in with a stray cat in trouble.
I don't know if it's been injured.
A good Samaritan found the cat nearby lying motionless on the ground.
So I can see a bit of bruising on the chin here. A little bit swollen, isn't it?
Yeah.
Hey, let me just have a look in your mouth, mate. Yowza. Ooh. So that's actually a fractured jaw right down the centre. So it looks like probably this cat has hit the ground hard, so probably jumped from something, out of something. This would be quite an excruciatingly painful injury to suffer for this cat. It's always associated with trauma, so this cat would have hit its head hard and has snapped its jaw in half. Okay, well, let's just scan her first of all and see if she's got a microchip.
Try and find your mummy or daddy, shall we? Oh dear.
Nope, no microchip.
Damn.
Well, that's going to make it more difficult to find your owner, isn't it? It's very disappointing to find out that this cat has not been microchipped, which is just so important for pets to be able to find their way back home to their loving owners. Should we be calling you a boy or a girl?
Yes.
Definitely a girl.
Oh, hello, darling.
A little bit sore over her hips there. She's just not happy about me feeling those.
So do you think she's fallen or something?
I think that's incredibly likely. She's got soreness in her limbs, she's got an injury to her face, and she doesn't have frayed nails. So she's likely leapt out of one of the buildings nearby and hit her head on the way down. But we definitely are going to have to fix this jaw. But more importantly, we need to find out who owns you and loves you.
Oh, that hurt.
But with the lost cat in pain, the search for the owner will have to wait. The priority is surgery to fix that jaw.
You gonna wire it?
Yeah, I'm going to have to.
Oh dear.
Nearby in southwest London, one of Scott's patients, the heavily pregnant Bonnie, is overdue. Owner Sophie is becoming increasingly concerned about the impending birth.
I'm quite anxious. I've never done this before. And I don't know whether it'll happen in the middle of the night or first thing in the morning. I'm not sure how many will come out, whether I'm supposed to sit there with a pair of scissors or something. I really don't know.
Sophie's hoping Bonnie's puppies will help the whole family through a recent bereavement.
We lost my dad at Christmas, and everything felt very low, very dark, very grey. I was suggesting crazily to my mum, let's get a dog, you know, you could have a dog and it would keep you company and it would be lovely. So I thought perhaps if Bonnie had puppies, that might be a nice thing, even though it's a madcap idea.
Here she is. Good boy.
Today, neighbour Sarah is dropping in for some much-needed moral support, along with the proud dad.
We'd known Sarah up the road for a while, and she has a lovely dog called Sebastian, who actually looks pretty similar to Bonnie.
Happy to be here.
I wrote a little note and I posted it through the letterbox saying, I wonder if Sebastian's available this evening. And she came straight round with him. You're going to be so happy together. So we had him for the night, and then she said, I'm not sure that'll be enough time if you really want puppies. So I said, well, we're going on holiday. So she said, well, you can have him. So we had Sebastian with us for a week, and he didn't leave Bonnie's side. I think it was love at first sight for them both. Got to keep your strength up, little one.
With Bonnie now overdue, Sophie has booked her in for another ultrasound with Scott.
I'm hoping that if Scott's on standby, I won't be alone in all this, but who knows? I really don't know. We'll be okay.
Okay, all right, bear with me a second. Scott, is that a stray cat?
Yeah.
I think I may have the owner on the phone.
No way.
At Richmond, Nurse Gina has just taken a phone call.
Hello, it's Scott the vet here.
Oh, hi there, Scott.
That may solve the mystery surrounding the lost cat with the broken jaw.
We've got a black and white female cat.
Okay.
Beautiful green eyes.
Yeah.
So what's her name?
I call him him. His name's Bruce. He's really friendly. Is he okay, or?
She is fine. I think she's probably struggling more with her name than the injuries. But
Oh, Bruce.
having an owner who calls his girl cat a boy, even though it's actually a girl, it's pretty confusing.
Can I just ask, why do you refer to her as a he?
Because when I wanted to get a cat, I was insisted I wanted a boy. But then when I seen him, I thought I had to have that one, and unfortunately, he was a female. But I called him my little man and everything.
The fact is that Bruce is my patient. She's had a hell of a fall this morning, and I do need to make sure she's okay, because to be honest, I just don't know how Joseph would cope without her. She has definitely suffered what seems to be a fall. Sadly, she's got a broken jaw.
Okay. I live like 2 stories above a restaurant, so
That's where she was
come, like,
found.
from 3 floors up. If he had to, the only way he could have got out was by jumping out the window.
3 stories. That's incredibly lucky. All right, mate. Well, look, I will look after your lovely Bruce, the girl, but we'll call him a boy so he doesn't get confused. And hopefully I look forward to meeting you shortly.
Okay, I'll see you soon.
Okay, Joseph. Take care.
Bye.
Hey.
Nice
Oh,
guy.
bless him.
Loves his cat.
Yeah, it sounded like he really panicked this
Your daddy
morning.
loves you.
You're too pretty to be called Brucey and a boy.
If I made up this story, no one will believe me. There's a cat that manages to survive jumping out of a 3rd-floor window, then gets rescued and brought to the practice. The owner then reports to us that he calls his girl cat a boy. It's honestly unbelievable.
Minutes later, distraught owner Joseph arrives at the practice.
Hi, I rang up earlier. I think you've got my cat, Bruce.
You're Joe, aren't you?
Yes.
Come with me.
Thank you. When I woke up this morning, I was terrified. I just worked myself into a panic. I couldn't concentrate, I wasn't thinking, I was banging on the neighbours' doors. I just want to have him back in my arms.
Do you want to go in first?
Thank you.
I don't want to get in the way.
Hi, Joseph.
Hi. Oh, God, my baby.
Hello.
Oh, he knows you.
What you got?
No, look.
Oh my God, you don't understand what it's been like without him. Bruce means absolutely everything to me, so I just can't imagine my life without him, if I'm perfectly honest.
There's true love going on here, isn't it? I'm feeling very emotional.
I got him when I lived in Nottingham when I was 21. I literally did a Dick Whittington and picked my black and white cat up and just trotted down the M1 since me and Bruce started our life in London like 4.5 years ago. Just to think this morning that he wasn't there to continue this journey with me was devastating.
What we need to do now is some x-rays first, and then I'm going to wire his jaw, which I know is broken.
Okay.
All right, so be brave, be patient, all right? Grab a seat upstairs and we'll look after your little...
Man.
Man, okay.
We'll take care of him.
We will.
Thank you.
We will. He's gorgeous.
I'm just so worried about him, like, he's my baby. Just want him back home. Now.
Should we fix your face?
I'll sort you out.
Good boy. Hey, Brucey. You gonna have a little snooze?
All right then, sweetheart. Good puss.
At Richmond, the operation's about to begin on Bruce's broken jaw.
We'll fix you all up.
Owner Joseph has revealed Bruce must have fallen from their 3rd floor flat and somehow survived.
I am so anxious, like literally I don't know whether to stand up, walk. It's just not a nice feeling.
Oh, look at that, Jem.
Oh, blimey.
Nasty.
That is nasty.
The two sides aren't together anymore and we need to make them together. Okay. So the way we're going to do that is by using a bit of wire. Just go around both the canines and then back under again.
It's a very big needle.
Yeah, it's not the most attractive
No.
of surgeries. There shouldn't be any reason why this cat wouldn't be able to eat. It's just all about holding that jaw together so it feels normal to eat. And what I need to do is now twist it tight to squeeze those two sides of the jaw together. That stays in place for maybe 4 or 6 weeks until the jaw's healed, and remove it and Bruce will be back to normal.
I cannot wait for this to just be over. He's my everything, so I can't actually describe how much I want to see him again.
But Joseph's vigil is almost over. The operation's been a success, and Bruce is waking up.
What do you think of your new jaw, hey? Snort of satisfaction. We'll go and speak to your daddy, hey?
Upstairs, Joseph has just received another unexpected surprise.
I have just been handed a letter of the person that actually found Bruce this morning. Dear Bruce's owner, my neighbour called me at 5:15 this morning to ask if I could help as she had found a cat she thought had been hit by a car. Having spent some hours with him, I have to say I've fallen in love with him. Oh, she calls him a him. So if you ever need a cat sitter, please don't hesitate to call me. All the very best. P.S. This is a copy of the poster my daughter threw together at 6 a.m. in an attempt to find you before you went to work. I'm just over the moon. I can't believe it. Bless her.
Where is he?
And just when things couldn't get any more emotional...
Hello. There you go.
Hello.
There's your, I'm going to say cat.
Oh, little boy.
He's a very, very lucky cat.
I cannot believe I have finally got him back in my arms. Like I said, this morning when I woke up, I was in such a panic. I didn't think I'd ever see him again, but thanks to the fantastic people at the vets and such genuine, nice people in the world who found him, I finally got him back in my arms where he belongs. I've missed him so much. He's very lucky. He's used up about 12 of his 9 lives, but he's a fighter, and it's a happy ending to this story, thankfully. I was so worried, Bruce.
Come on, sweetheart. Good girl. Good girl.
At St. Margaret's, Scott's now finding time to look after his own family.
Hi, girls. I've got Betty with me today.
Hi, Bet.
Last year, his 10-year-old Border Terrier suffered an horrific spinal injury. which almost claimed her life.
How is she walking at the minute? I've not seen her for a few weeks.
Yeah, she's not doing too bad. The left leg is still a little bit weak, and she sort of drags it a little bit. And look at her, bless her little wonky tail.
Oh,
she's got a very slow wag. That is good.
Scott had been playing with Betty in the park when she suddenly collapsed.
She's burst a disc in her back, and some of the content of the disc is now squashing the spinal cord. Worst case scenario is she never walks again.
I knew it was bad, but it's really bad.
Betty's only chance of recovery was a risky spinal surgery with no guarantee she would be able to walk again.
Clever girl, look at that.
Fortunately, after 2 weeks of physical therapy, the terrier was able to take her first steps.
It was life-changing, really.
Good girl.
And I think I was caught off guard by exactly how much I did love her.
But 10 months later, Betty still walks with a limp.
Yeah, all right, should we go with Auntie Ems and get some laser done?
Come on then, Miss Licks-a-Lot.
Today, Scott's hoping his new laser machine will help speed up Betty's recovery.
Okay, wear protection goggles. Check. Yeah, all right. So let's just give this a go, shall we? It won't be painful. You will hardly even feel it. Might feel a little bit tingly.
Do you go over the scar directly or do you go around it?
Just sort of all around it in a bit of a grid pattern, really. I'm going to do a little bit down the leg as well, but it's just to try and see if this laser light will optimize healing in the damaged area of her spine.
The laser light triggers a photochemical reaction in the body that increases blood flow to tissues, which helps to grow and repair cells.
It'll reduce inflammation, it'll reduce swelling, hopefully reduce muscle stiffness, spasms, and just decrease pain. At the moment, Betty does need to take some pain relief every now and again. She is quite sore sometimes, and it does mean that her movement is limited. But I'm hoping the laser therapy will help to reduce the amount of drugs she needs, reduce the pain that she's suffering, and make her move a little bit more comfortably. So that's the hope, isn't it?
That
Make you
sounds-
nice and comfy.
Betty didn't flinch once during the laser therapy. I don't think she's even noticing it at all. I think she's just enjoying her attention afternoon.
There we go, sweetheart. Laser therapy done. What do you think? Hey? Betty seems to have loved it. Her tail seems to be wagging a little bit faster and she's already moving a little bit smoother. What a clever girl. What a clever puppy. I think it's been a very successful result and hopefully it'll lead to a pain-free life.
No, I love you. Yes, I do, baby. Every little bit of you. Even your wonky tail. Yeah.
Wow, Bonnie, here we are.
Sophie and her daughters Tess and Rose have now arrived at the St Margaret's Practice for Bonnie's ultrasound. The 3-year-old poodle Cross is having her first litter, and Sophie's hoping Scott will be able to tell them just how many puppies are on the way.
Hello, ladies. How are you?
Hello.
Hi, Sophie.
Hi.
Hi, Bonnie. Hello, baby. You're looking ready to pop, aren't you? Come on, gorgeous. You guys follow me down. Let's go.
I think it's so good for the girls to see the ultrasound and just see real life. It's an amazing thing.
There.
Oh my gosh! Look at
Can you see? It is incredible. I mean, even for me, it's very special.
Yeah.
I'm looking at the ultrasound and sharing this moment with Sophie and the kids. Honestly, I've got goosebumps. It's an amazing experience, and it's so wonderful to be a part of it. A privilege, really. And that just shows we've got nice, healthy little puppies in here, just waiting to meet the world. There's another heartbeat there. So I can definitely spy 3 so far. It's quite hard to tell, but I think there might be 4.
An X-ray is the only way to be certain about how many puppies Bonnie is carrying. But Sophie has said no to the X-ray because of the potential risk.
Sophie wasn't too keen on X-raying Bonnie, fair enough, it's radiation at the end of the day, but it is much easier for a vet to be able to count the amount of skeletons present in a dog's abdomen. An ultrasound does make it more difficult to count the amount of babies that will be present in the tummy, but it does give us a much clearer picture of how healthy they are. Oh, there we go.
Oh my gosh.
Do you see that? Yeah. So that's some legs kicking about in there.
Scott, would you like one of the puppies?
Oh dear, you put me in a spot there, Sophie. I tell you, you really put me in a spot. My dog Betty went through hell and back last year, so the thought of a new puppy right now was just the last thing on my mind. So although Sophie's offer is incredibly generous, it is just something that I'm going to need some time to think about. They're looking beautiful though. It's very exciting.
I think Scott looked a little bit shocked when I said, would you like the fourth puppy? So we won't force it on him, but if he wants it, he's welcome.
And how are you guys feeling about the actual impending birth?
I'm a little bit worried about it. I've never done this before. Can we give you a call?
Of course you can. I'm more than happy to be by your side for this. It's so exciting.
That's good.
But at the same time, it's quite nerve-wracking. If you've never been a doggy grandmother before, then yeah, certainly here to help. Yeah.
A reassured Sophie will now take Bonnie home to count down the hours. It's going to be an anxious wait.
Well done, sweetheart. Yeah, it's nearly over. Hey, we'll get those puppies out of you soon. Yeah, we will. Yeah, we will.
Let's get you to the vet, shall we? You get lots of cuddles and lots of treats there, don't you?
On Richmond Hill, 10-month-old Barkley is having a final walk with owner Pam before he goes in to see Scott for a highly sensitive operation.
This way. That's a good boy.
The English bulldog is about to be neutered.
I've tried to tell Barkley why he's going into the vets and just said to him that you make him more mature. I think that might be the right way, as he might behave a little more sensibly. I tried to put it that he might actually feel he's lost a little bit of weight as well, which for a bulldog has got to be, a plus.
And fetch.
Castration may be regarded as a routine procedure, but Pam is still very anxious.
Barkley, 100%, is the light of my life.
Come on, let's go and see them in the vets.
There are no cuddles like Barkley cuddles. Yeah, they're brilliant.
Hey.
And as soon as Barkley makes his grand entrance at the Richmond Practice, there's cuddles for everyone.
Oh, he's so forward.
Hey, Barkley! Hi, mate! Let me save you from all those girls.
I don't think he's going anywhere, right?
Barkley, come and have some boy time. Whoa, Barkley, what a ladies' man. I thought he was coming in especially to see me, and I've just had to drag him away from all the girls.
So better get back to work then.
Chick magnets.
You managed well.
Haven't you?
You managed to get him away.
How's it going? You all right? Hey?
But the chick magnet is about to lose his manhood.
So it's his big day today. How are you feeling about that?
Nervous about the anaesthetic, obviously, with the breed of dog and everything.
Well, and the fact that we've just heard his breathing like that.
Yeah. No, exactly. Now, obviously, just can't imagine life without him now.
I will look after your boy, I promise. Oh, you're a good boy, aren't you?
You are. You are such a lovely
I know
boy.
you're in good hands. See you soon. See you soon.
See you, Pam.
Thanks a lot. Bye-bye.
Towards myself now. Oh, yes, I do. Yes, I do. Yes, I do.
Oh, you have no idea what's going to happen.
That's
do you?
right. Doesn't need to be told too much about the details, I think. Hey?
Is that because you're uncomfortable talking about this sort of thing? Or?
It does. Yeah.
Does it make you?
Yeah.
A little bit of that?
Yeah, a little.
Okay.
I think any bloke would respond in the same way.
I'll continue to wind you up throughout.
All right, mate.
Oh, I just need a tube.
Head vet nurse Emma is assisting Scott today. It seems Barkley's operation is leading to some interesting topics of conversation.
You know what I don't get is why people would choose this as a job. Like on people.
Oh, what, just like grooming in general, you mean? Scaping.
Scaping.
Manscaping.
Oh, man.
Listen, you can't judge a bit of manscaping,
God.
okay?
Keep your front garden well pruned.
Well, listen, there's nothing wrong with a well-groomed garden, okay?
No.
I'm told it, well, I think I should just stop talking and walk away. As you were, continue.
While this is definitely no laughing matter for Barkley,
Okay, so I'm going to make first incision now.
fortunately, the neutering is all going according to plan.
You won't miss him. My wife wears mine as earrings.
Really?
Until Nurse Gina interrupts with important news.
Hi. I know you're busy.
Go on.
Sophie's just called and she thinks the puppies are on their way.
You're joking now?
Okay.
Okay, that gives
Right.
us an hour, give or take, Doc. Until
Well,
we.
I'll definitely get it finished in time then. That's fine.
Earlier, Scott performed an ultrasound on one of his other patients, 3-year-old Bonnie. After promising to help with the birth, the SOS call has arrived from Bonnie's owner, Sophie.
Hello. Hi, Sophie, it's Emma.
We're calling you from the surgery room right now, Sophie.
So obviously we'll be there with all hands on deck as we need. Hopefully she's not going to need too much intervention from us, and we'll just try and let her do it herself.
Okay, cool. Thank you so much.
All right,
All right.
we'll see you soon.
See you soon.
Bye.
Bye. Just as we're removing Barclay's ability to have babies, we're about to deliver
The
some more.
irony is quite spectacular.
There's a bit of irony there. Good old Barclay, poor little man. After what I've done to him, I really hope that we'll still be mates. You sleep it off. But I've given him lots of fuss, given him lots of love. And now, though, I've got to get across to Sophie. And I can just hear it in the back of my mind going, hurry up, hurry up. Well, I'm on my way.
I don't know if I've had enough coffee today to do what we're about to do.
Scott and Emma are on their way to St Margaret's after getting an SOS call from Sophie and her husband Tom.
Tonight's the night, Bonnie.
Their much-loved Bonnie is having her first litter of pups, and she's overdue.
I think she's shaking a bit.
She is. There's a lot of panting, and so I think she's going to be very soon. Come on, darling.
Hi. Hi, expectant grandmother. How are you?
Everybody, the vet's here.
Hello, everybody.
Very good to see you. Hi.
Hello. Hi, Tom.
I'm very glad Scott is here, because if we were doing this on our own, I would be very concerned by now that things hadn't done exactly what the textbook said.
Let's just have a little feel. Wow. That's one full dog. Hey, you're about to pop, aren't you, sweetheart?
So I'm so grateful that he's here, making sure that we won't be left alone and that she won't be suffering.
All right, so I'm just going to have a little look.
Good girl, brave Bonnie.
Cervix is just starting to dilate. Now, I can also feel the puppies' heads are about this big. So they may be like sort of the size of a large plum. So that's how big her cervix has to be in order to pass the puppies. All right? You look nervous, you're right.
I am nervous. I suppose, yeah, I'm worried that won't get big enough to get those heads out.
So we just need to work together. We need to be patient, and we need to make strategic decisions in order to get the best result possible.
It's felt like a long time. It's been days we've been on tenterhooks, actually. And so tonight's the night. I just hope so much.
3 hours later, and Scott's worried the labour is moving too slowly.
We should see more contractions. We should see more attempts at sort of getting these puppies out, and we're just not seeing that. So what we have to do is just be careful that we're not letting it go on too long, because, of course, then we can start having worries and concerns about the puppies.
1 more hour goes by, and Scott decides to give Bonnie a shot of oxytocin. The drug is used to stimulate contractions.
Oh, she's a good girl. So brave. That's right. Good girl. Good
That's
girl.
it, good
Come
girl.
on. Push now. Come on, Bob.
Good girl. Come on, honey. That's a big one. Come on, there we go. Come on.
It's so frustrating because I can feel this puppy. It's just at the end of my fingertips. But it's just not progressing down the birthing canal and out. She's pushing and it comes, and then as soon as she stops pushing, it just jumps back into the abdomen. We should definitely have had a puppy by now. And I'm just starting to get concerned that this puppy is getting a little distressed.
The chances of a successful home birth are fading fast.
A lot more nerve-wracking than I thought it would be. And I'm amazed how close I feel to her. You know, just the fear behind her little eyes. I do feel for her. Just whatever you can do that's the best for her and the pup.
Finally, Scott is forced to make a tough decision. He's now convinced a caesarean section is the only option for Bonnie.
I'm really starting to worry about the condition of the puppies now. What we need to do is get them out. And none of us want to go down the route of emergency surgery, but I do need to keep Bonnie's health in mind as well as the puppies. Come on, baby. Luckily, Sophie and Tom have just found a babysitter next door, so they're ready to go. We need to go to the practice, we need to get into surgery, and let's just hope that the puppies survive.
Good girl.
Come on in, guys. That's it, there you go. Right. Through we go.
By the time they arrive at the practice, Bonnie has been in labour for 7 hours.
Hey, Nath.
Nurse Nathan has already arrived to help out.
Thank you very much for coming quite so quickly.
Oh, that's right. Sleepy time now, okay? So say goodbye. So you guys are gonna see you go to sleep, and then we'll get you to pop up to the waiting room, okay, while we get the surgery done.
I hope that everything's okay, because you never know. I mean, maybe there's something wrong.
It's all going to happen pretty quickly now.
Okay. I really hope that everything's good and that there's lots of little ones there.
Okay, all right, baby. Okay, here we go. Just wish I didn't have to do this, poor thing. Just be very careful with this incision, because the babies are very, very close, and they're very packed full in this tummy of hers. All right, babies, out you come. Okay, who's on baby catching duty? Ems?
I'm on.
Okay, all right, okay, you ready?
Yep.
Okay, there you go.
All right, little pups. Come on, little pups.
Okay, do the swing if you need to.
Yep.
And like rub harder than you think you should.
Emma is trying to clear the fluid from the puppy's throat and nose to help it start breathing.
Any luck?
No, not yet.
The second puppy is also grey and lifeless.
I'm really worried about the health of the puppies. They should absolutely be making sounds by now, and they're not.
Come on.
They're not crying, they're not doing anything. I'm just so concerned that this is going to end really badly for Sophie and Tom.
Come on, little pups. Come on. Come on.
With Emma and Nathan desperately trying to kickstart the first two puppies' breathing,
Ask Sophie if she can come down.
Scott has no choice but to enlist the terrified Sophie to help puppy number 3.
So I'll give you the puppy, and then what you're going to have to do is, careful, don't touch anything green. That's it, pull back. So, don't touch that either. No. Just stand where you are, stay still.
I'm quite anxious. I've never done this before. And the thought of their life being in my hands is nerve-wracking.
And what you're going to do is you're going to rub it really firmly on the chest, okay, really firmly, and stimulate. Ems, can you help Sophie with that one? Just watch whilst tell her to do what you're doing.
Yep.
Have you got movement in yours yet, Ems?
Yeah.
Yeah, Sophie's just taken over mine. I've just taken over hers.
Do we keep doing it after?
Yeah, we just keep going.
Keep going.
I've never done anything so terrifying in my life. This evening cannot bring any more shocks and surprises, and it's just incredible.
But there are more shocks to come.
Oh my God.
Have you got a fourth one in there?
I've not just got a fourth.
You got a fifth?
I've got a fifth as well. So, oh gosh, I might even have a sixth. Right, okay. Someone needs to brush up on his ultrasound skills.
Oh my goodness.
Come on, open your mouth, come on.
We've got mouth movements from everyone.
Oh good, it's nice to see that, isn't it? To see that. Mouth movement.
Just remember to keep rubbing. We need to keep him stimulated. We don't want any of this to stop.
Vet nurse Gina has also arrived with another much-needed set of hands.
Ems, how's it going out there?
And it seems the team effort is finally getting
3,
results.
4, 5, 6. Breathing puppy.
Hey, good job. Well done.
And then, at last, the sound they've all been waiting to hear.
Oh, I did hear a squeak.
We've got squeaking. You're gonna wriggle away, little dude. Come back. I'm feeling so emotional. I'm welling up. It's so special that we're able to bring in life. It's a privilege. It's a complete privilege that we're able to do it.
Yeah, I do feel like I'm missing out. I can hear those cute noises, and I'm yet to see them. They sound gorgeous. And as a vet, you love animals, and cute little puppies and 6 of them in a row. It's incredible. I mean, it's incredible.
Hi, love, it's me.
Sophie can't wait to share the news with husband Tom, who returned home earlier to look after their 3 children.
But there's actually more than 3. There's 6.
My goodness me, that's unbelievable.
It's unbelievable, I know. They're so beautiful.
Clever, clever girl.
We're squeaking, we're wiggling.
Oh, man.
We're making me cry.
Oh, you're fantastic.
It's 4 a.m. when Tom arrives back after finding another babysitter.
How amazing. Oh, they are tiny.
Yeah.
Oh my goodness, they're absolutely perfect. I can't tell you how happy I am. I'm so pleased. I'm really pleased that Bonnie's doing well as well because, she's done a big job tonight. It's been a big day and I think she's been amazing. 6 perfect little
really
puppies.
Worried when it had to be a cesarean. Really worried, and to have such a wonderful result. It's just perfect.
Yeah, it's amazing.
She's still sleeping, but she's here.
Oh, that's just amazing.
Thank you. We feel like she's in very safe hands.
Yeah. Well, I'm actually very pleased, of course, you were there right from the start because, if you hadn't been there, I'm not sure we would have seen all the 6 puppies and Bonnie the following morning. So it's been amazing. So thank you very much.
No worries. It has been amazing.
It has been
We're
amazing.
forever bonded now. Hey?
Hey, is that you coming back? Hi, Bonnie. Beautiful puppies.
I think she can probably hear them.
We've got a big family to look after now, so you must get better.
Yeah.
She does.
Have a few hours of rest and then I think it's all going to start, yeah?
I think 6 babies at once.
Oh.
Can you imagine? So you guys want to go and see the kids, get some
Yes.
sleep.
Yeah.
And we'll see you tomorrow.
6 puppies.
I know. What a result.
A result.
Let's go and tell the kids.
Yes.
Tomorrow, Bonnie will be introduced to her new babies.
Morning.
Morning.
But tonight, she needs to rest and recover from the surgery.
And doesn't that make it all worthwhile?
It really does.
Scott and Emma will be keeping an eye on them all until the morning shift arrives.
What an amazing, exhilarating, at times scary, but fantastic experience. And people might think that we as vets and vet nurses must do this all the time. Honestly, we don't, and it's just as special for us as it is for Sophie and her family.
Somewhere got to be serving coffee in Richmond, surely.
At 4 in the morning?
There must be somewhere.
You've got your babies here.
Here we go.
I told you they were coming.
Oh, look at that little bundle of joy.
Next day, after just a few hours sleep, a weary Scott's back at the practice to check up on Bonnie and her 6 puppies.
So 2 boys, 4 girls.
Practice manager Maz is the latest to fall under their spell.
That's a little, very vocal girl.
Yeah, one of them's standing right next to you.
Yeah, I know.
I should if I were you.
No, I won't. Look, hello, baby. Oh, I know. Good girl, you're cleaning them. Clever girl. Those maternal instincts are really kicking in now, aren't they? Last night, after she recovered from the anaesthetic, Bonnie really wasn't that interested in her puppies. Fair enough. But this morning, thankfully, she is all over them. She absolutely loves them, and she's being a great mum.
Meanwhile, Barclay is recovering well from his big operation and also wants to be the centre of attention.
Hello.
Hi, I'm here to pick up Barclay.
Okay,
Yeah.
take a seat and Scott will be with you in a minute.
Upstairs, his owner Pam has arrived, and the bulldog is making it very clear that after being neutered, all he wants to do is go home.
Oh, can you hear your mummy? Can you? Come on then, mate. Let's go.
No, I've not heard that whimper before, so yeah, I can't wait to see him and give him a reassuring mummy hug afterwards.
There she is.
Did you get Scott to carry him, did you? Yeah. I am so relieved that Barclay's well and he's going to be fine. I know he is.
We've got to have that beer down the pub, don't we, mate? Hey? Yeah, when you're feeling better.
Yeah.
He might seem a little sore and a bit whimpery at the moment, but when the family give him cuddles too, he's just going to be, you know, he's going to be loving it.
See you,
Take
Pam.
care.
All the best.
We'll be
See you
back
soon.
Bye. Thanks very much. Bye-bye.
Oh, he still wants to stay. Wow. Bye.
And later that day, there's more precious cargo ready to leave the practice.
So there's 2 that are kind of caramelly coloured.
Tom and Sophie are
4
back at
that
Richmond
are,
with a very excited
a
Tess,
bit more
Harry
pale
and
and
Rose.
curly.
They're about to meet Bonnie's babies for the first time.
Here we are.
Hello.
Go. To see those kids' faces light up is just incredible. It's the reason that Sophie and Tom did this in the first place, is to just show them the joys of birth, and that's exactly what we've given them.
They're so adorable.
Really amazing holding little life in your hands. It's just like amazing. It's a girl.
It is.
How can you tell?
You know what? Ask your parents. Honestly, I've got 3 kids of my own. I'm going to have those conversations at some point. I'm going to leave that to you. All right. I'll explain the veterinary stuff. You can do birds and bees. All right.
Scott is still making up his mind whether he wants to adopt one of the puppies, but he's got plenty of time to decide. It will be at least 8 weeks before the pups are strong enough to leave Bonnie and go to their new homes.
All right.
It's okay,
so
babe.
much
It's
for everything.
okay. I think it's going to be a fairly chaotic household, but with 3 kids and 1 dog already, I think we've already got enough chaos there. Just adding another layer. But thank you so much.
My pleasure. My pleasure. You're welcome. You're very welcome. I cannot wait to see them grow up and see what little personalities come out of those little furry bundles. Bye.
Bye, thanks.
Bye. Oh, now I can go and have some sleep.
7 weeks later, and Scott's catching up with Pam and her husband Darren for Barclay's first birthday.
Finally, we get to hang out at the pub.
I know, we've been saying it all the way along.
Do you love going to the pub? Hey, love going to the pub with your dad? Hey, all right, governor?
Oof, that was a tongue in the mouth.
He likes going anywhere, but pub being one of his favourites.
Saturday night treat, isn't it?
Saturday night treat, yeah. Yet to try the beer, but he's got to wait till he's a bit older for that. No, he's sticking to water still.
Yeah. Well, I noticed it's good to see you guys together because you were kind of conspicuously absent during the neutering process. Was this sort of like, don't blame it on Dad? Was that what it was?
Yeah, I thought I'd better... I felt for him, so I thought I'd better... I'll leave him.
Well, Pam has got you booked in next week.
Exactly. Oh, yeah. I forgot to mention. Yeah.
It seems like Barclay might have forgiven me for taking off his manhood. I'm not sure that Darren has, but I think Barclay and I were still good mates.
The English Bulldog only took 48 hours to get over his delicate operation and was straight back to his normal extroverted self.
Yeah. He is, exactly, yeah. No, we've kept reading all the books that they start calming down and they get less playful and more, docile. Not Barclay. Wears his heart on his sleeve and can't get enough of it.
Hey, although, you know what I think we need to do is next time we have a consult at the pub.
Yeah.
This feels right, doesn't it? Feels right.
That's the way forward, isn't it?
I think it's the way forward. Love it. Diagnosis done.
Yeah, exactly.
Cheers, guys.
Yeah, absolutely. He's still saying, where's mine?
Where's yours?
Aren't you?
Where's yours? What's that?
No.
Hey?
As for Bruce, his jaw has completely healed. But Joseph still can't believe his best mate didn't die when he fell from the window of his 3rd floor flat.
Hey, is this the window you fell out of?
To have Bruce back home is beyond words unbelievable.
Are you happy to be home? Hey?
I'm just so happy to get him back and have everything behind us.
We're going to stay away from them windows. We're going to be grounded.
And just in case there are any more adventures, Bruce is now microchipped.
I managed to speak to the lady that found Bruce. I took around a box of chocolates, a bunch of flowers and a bottle of wine. I cannot thank them enough for what they've done. Yeah, absolutely over the moon with them.
Oh, you're sorry, aren't you?
At Sophie's house, all 6 of Bonnie's pups are thriving. It's been 7 weeks since Scott helped them make a dramatic entrance into the world by emergency cesarean.
The puppies are doing very well. They're getting bigger every week. They're just such a lively, cheerful presence. You come downstairs in the morning and you know you're going to be mobbed by happy little balls of fluff with wagging tails and smiley faces.
So you guys excited about Puppy Day?
After much soul-searching about their other dog, Betty, Scott and his wife, Zoe, have finally decided to adopt one of the puppies. Zoe's sister, Maz, has come along to help with the big decision.
Hi, Bonnie. I have to be the voice of reason and common sense, which is basically to remember that we have a house that has 3 children in it, and it also has a dog that's a little bit of an invalid these days. So we do need to have quite a calm puppy.
Oh, they are just gorgeous.
So they're a bit sleepy and dopey at the moment, but I can
That's only 2 of
introduce
their names.
Yeah. Shall I get one for you?
Oh,
yes,
wow.
To meet.
Hello, you. In first impression, I mean, they are gorgeous. They are absolutely gorgeous. There isn't an ugly puppy amongst them. They are all just absolute picture book cute. Something small, fluffy and cute, I don't know.
I love the little dog that Sophie has suggested for us. She seems very calm, very, very sweet, and she's perfectly healthy. So from my vet point of view, she's a healthy little puppy as well as being a beautiful personality. So that's the perfect world.
This is the man of the twin set.
Oh, hello.
And then Maz brings her own surprise. She's decided to have one of the puppies as well.
Isn't it great that Maz is going to get the little brother? So we've got the little twin set there to go together. And they're just so beautiful. I don't know how we're going to tell them apart when we're hanging out, though, because they're so identical. We're going to have to put very prominent coloured collars on them to try and work out whose is whose.
But everybody has to be patient. The pups will have 1 more week with Bonnie before they're ready to go to their new homes.
Another strong female, yep. Yeah, I don't have enough of them. Right.
Another girl will just bat her eyelashes and get whatever she wants. Go on, Daddy, 1 more treat.
Make a bit of tea.
In Twickenham, in southwest London, 34-year-old teacher Manpreet shares her bedroom with 2 very unusual pets.
Chippy and Speedy are like my babies. We don't have children, unfortunately, so, I've bonded with them. I know, people might think it's strange to have animals and call them your babies, but they really are. They're just so cute, and anybody who sees them, they fall in love with them straight away. Can I take Mummy's hand?
The cheeky chipmunks were a surprise 30th birthday present from Manpreet's husband.
Good girl, Chip. Well done. They're a bit like having a cat and a dog. I know them like almost inside out, and they just make us laugh with the little silly things that they do. Speedy, what have you found? Is that your hazelnut?
When kept as pets, chipmunks can live for up to 8 years. But now both these 4-year-olds have health issues.
Hello, hi, I'm Scott. How are you?
Scott, nice to meet you.
Which is why Scott and newly graduated vet Riaz are making a special home visit.
If you just follow me.
Should we close the door?
Yeah.
They're probably quite fast, I would imagine.
Exactly, yeah. Don't want
Hence the
any of them
name
escaping.
Speedy, right?
That's right, yeah. So this is Speedy over here.
Yeah.
And this is Chippy.
They're beautiful.
They are, yeah.
2 absolutely adorable little ones.
I know.
First up for treatment is Speedy.
She damaged her nail, and her new nail that's growing through doesn't grow properly, so it's quite long now, and she just can't seem to trim it by herself.
We see that a lot with dogs and cats,
Yeah.
and she just needs to get it trimmed a little bit regularly, and that's why I bring along my new vet.
Brilliant.
I think that means that I'll be doing the trimming then.
Well, you're an expert in trimming chipmunks' nails, aren't you?
Well, I will be after today.
For Riaz, I think it's a little bit of a baptism of fire.
Okay, so I'm going to let Speedy out. She'll come out by herself, but it's a bit difficult to handle her.
Absolutely,
Just a bit of
let's try it.
The moment the cage door opens,
Good girl.
Speedy is off.
She's gone under the bed.
Scott, I think we've been outsmarted, mate.
Catching Speedy's fun.
Yeah, she is right in the middle.
Her name should have definitely given it away. Oh, there she go for it, Raz, go for it. Go, be quick, be quick, be quick.
Oh. I'm being outthought by a chipmunk here. There's a bit of a standoff that's going on. Hopefully we come out on top.
Oh, you're all puffed out now, aren't you? All that playing.
Just 10 minutes away in St Margaret's, another one of Scott's patients, 7-month-old Sydney, is turning out to be a very cute puppy with some interesting habits.
Sid is a very mischievous dog. His favourite thing is to try and get up the stairs when we leave the stair gate open and go searching for a love interest, which seems to be a big, cuddly penguin in my children's bedroom. He likes some alone time with that penguin. We kind of have to leave him to it and rescue the penguin a bit later.
But while Sydney's enthusiastic antics make everyone laugh, there is a problem.
Come on.
Any strenuous activity is now becoming a threat to this French bulldog.
Come on then.
Just a romp in the park can be dangerous. Because of Sydney's severely compromised breathing caused by extremely narrow airways.
When you look at Sydney, he's such a gorgeous dog. He's so popular locally.
Sid! Sydney!
What people don't realise is that this dog is beset with problems.
All right, Sid. Okay. Good boy. Good boy.
Playing with other dogs in the park, I have to pull him away after 5 minutes because he gets so overexcited he can't breathe.
Come on then. Good boy. Good boy.
Sometimes he gets so bad I have to carry him home because he just can't catch his breath. It's really upsetting to see him getting distressed, and we know that he wants to run and play, and it really holds him back that he's just not being able to breathe and get the air down.
Good boy, Sid.
Jo is taking Sydney to see Scott later today, and she's hoping there will be a solution to improve her puppy's quality of life.
He's part of the family, and we'll do anything that we can do to make him better and give him the comfort he needs to get out there and enjoy the park. And we really need to get it sorted out quite quickly.
Oh, Sydney, you'll be better soon. Come on.
This is a fun game, mate. I'm being outthought by a chipmunk here. Getting a bit of a sweat on it.
In Twickenham, Chipmunk Speedy is determined to elude Riaz and Scott.
Keep doing what you're doing, Riaz.
Oh, and down she goes. I think she's down your left side.
Finally, after a few minutes...
Oh, she's back in a cage.
You are joking.
The cunning Speedy has the last laugh.
The sooner we get her, we can have a look at that nail, so I think that's what I'm sort of focusing on.
She's very fast. Oh.
Good girl.
Careful.
Here we go.
Brilliant. Oh, she's so cute.
So cute. She's absolutely adorable. I can see why you love them so much. And also, it was incredibly funny to get Riaz to run around like that.
I don't think I'm ever going to live that down.
All right, let's trim that little nail.
All right.
Speedy damaged one of her nails a little while ago when she was 1. She's now 4. And ever since then, it's been growing a bit abnormally. And it grows a bit too long and she gets it stuck in a hammock and when she's trying to sleep. So with Speedy, what we're going to try and do is carefully just cut the nail back down to a normal length so she's more comfortable.
That's beautiful. What do you think?
Oh, that's brilliant. Thank you ever so much.
Yeah, very good. Isn't it great that you do 5 years of vet school and then you can do a manicure? All right then, Speedy, I think you can go back. Beautiful girl. And be quick with that door.
Yeah, I will do. Don't worry.
But suddenly...
Oh, dear.
There's a problem.
When I went to put Speedy back into her cage, she collapsed and fell off her perch. Realised that she wasn't breathing and my heart was in my mouth the whole time.
All right. Is she okay?
It's all right, I know. What's happening? These are the moments as a vet you dread. You're doing what seems to be a minor procedure on an animal and then they drop. My mind's racing, but I act very calmly. But at the same time, I'm thinking, what the hell just happened? Open the window. For a little creature, they're very prone to stress. She just needs to get a good gulp of breath. Hey, there you go. That's it. Good breath. Good girl. Good girl.
Is that normal when they get stressed? That's what happens?
No, that's not normal. No, but she's basically fainted is what she's done. So, haven't you? Hey?
You can't imagine how I felt when he said she's breathing. I was so relieved because I had a flash in front of me thinking that that's it, I've lost my baby.
Hey, you gave me a heart attack.
You? I didn't expect anything like that to happen.
Good girl. There's Mummy. Look at Mummy. Look at that beautiful face. There you go. And you're back.
Good girl.
Right, good girl. There we go. Let's put you there.
There you go. You scared all of us.
You're right. I had a heart attack as well. I know. That was close. Yeah.
After the scare with Speedy, everyone is now apprehensive about the checkup on Chippy.
About a week ago, I noticed her underside of her belly was slightly swollen. It looked really pink on one side and not so much on the other, so I'm guessing that there's something wrong there because otherwise it would be on both sides, right? If it was, so maybe we could check that out
absolutely.
as well.
After the lessons learned with Speedy, I decided that this time around we were going to leave Chippy in her cage and try and capture her that way. Let me have a little feel back here. So can I get you just to hold that leg?
Mm-hmm.
That's it. And Riaz, if you hold that leg, nice and gentle, let's have a feel. Manpreet, I have found a lump.
Okay.
It is a solid mass and it is present in her mammary tissue, basically the breast tissue of your chipmunk. So it looks quite angry.
Okay.
Yeah, that is a concern.
She's my little baby and it's the size of a pea now and we don't know if it's okay, if she'll be okay or if it's something a bit sinister.
Good girl. So I know you're very worried about your little princess, but we just need to take her to the practice, have that anaesthetic done, remove that nasty mass, and then wait and see what the results show.
Okay. Brilliant. Thank you ever so
All
much.
right, no worries. Thank you.
No worries.
Let's go.
We had this traumatic experience with Speedy and I never thought that would happen with her. So there's every possibility something could happen with Chippy as well.
All right, so we'll get off to the clinic now and I'll give you a call just as soon as she's woken up.
She might go into shock. She might not react to the operation too well. I'm not sure. So I am really nervous.
See your friends? Can you say cat?
30 miles away to the west in Marlow, Scott's good friends and fellow vets Claire and Michael Hamilton are worried about their 11-year-old Devon Rex cat, Winston.
He was our first furry baby. Our first little furry baby together. Stroke him gently.
He's an important part of the family and he loves Maya. If you see them together, it's hilarious. I mean, he kind of rolls on his back and Maya's kind of gently slapping him like this. Gently. But he loves it, so they're really good together.
Ever since he was a kitten, Winston has been plagued by serious health problems, and now his symptoms are getting worse.
We first noticed when he was about 6 months old. He developed allergies, so he was pulling his fur out and he was really itchy. He used to vomit a lot and he was really, really skinny. Eventually, we diagnosed him with inflammatory bowel disease. We managed him with very, very strict hypoallergenic diet and steroids. He's done great for 10 years.
But of late, we've spotted him getting a bit bad again, and he's continuing to lose weight. He's continuing to pull his fur out. Something's changing, which is a bit of a worry. He's already been fed twice today.
He eats and eats and eats and eats. So he's eating a lot, but getting skinnier. Our concern is that in a lot of cats, IBD can progress to low-grade cancer. It would be devastating, but we would know what we were dealing with, which would be the best thing. So.
Let's wait and see.
Sorry, I made myself a bit emotional. We feed it to Mr. Winston. It's really, really difficult as a vet when your pet gets sick, being on the other side of the fence, because you don't have the vet to go and ask. You have to make the decisions for yourself, but you're emotionally involved. You know, you love this little furry creature.
I'd like to think that I'm the voice of reason. However, I'm quite worried about him this time. So, yeah, there's something not quite right.
Having ruled out other causes of Winston's weight loss, Michael and Claire have decided not to administer steroids, as they have done in the past. Given the severity of Winston's symptoms, they now need to take invasive biopsies.
We need to rule in or rule out the bad stuff, because if we do give him the steroids, which might mask stuff, we might never diagnose it. Because if we miss the low-grade cancer and we don't treat it, that he's not going to be around for an awful lot longer. What do you think? You're just thinking, that's quite nice, scratch my chin.
Hi, Kirsty.
Hey, Kirsty.
Oh, chipmunk.
Chipmunk, Kirsty, chipmunk.
Meet the chipmunk.
Come on, let's get you downstairs.
Big day.
Scott and Riaz have arrived back at the Richmond Practice with Chippy for her breast lump removal.
Okay, guys, so with this, we have to be quite efficient because we've got a little mammal that's prone to stress, as we certainly learnt this morning. Don't need that again.
Riaz and nurse Sam will be assisting with the procedure on the 4-year-old chipmunk.
Sound good?
Sounds good.
Yep, let's do it.
Let's go for it. Anaesthetics and surgery in small animals is always a risk, but chipmunks, they're so small and delicate, of course, it's even greater risk. So we need to make sure that with this procedure, it's as quick as it can be and she can recover as quickly as she can. Go right up to 5 to start with, because she's light. With a lot of animals, we can actually give anaesthetics via an IV line or straight into their blood supply. But with the chipmunk, their blood vessels are very small. So instead, what we're going to do is an inhalation anaesthetic. She'll breathe that in, and then she'll be knocked out and ready for surgery.
I think it's my least favourite way.
Well, I'd like to see you try and get a vein
Yeah.
on this one.
I think that would be a challenge.
Let's take her out and get her straight onto a mask. Okay. That's it. What I can see here is a very angry looking mammary mass. So she's got a little lump in her breast tissue, which is quite concerning because she is an older chipmunk, and therefore older people get cancer more regularly, unfortunately. And in this case, I think that might be what it is. So what we need to do is to remove it, but at the same time remove enough tissue around the outside that if it has spread a small amount, then at least we're taking it away. We're doing the job once and doing it right. Okay. Yeah, it's a hard lump and actually pretty big.
Fiddly.
So I've got the lump out completely and I can feel there's a nipple there, and then underneath is this hard lump, hopefully surrounded by healthy tissue, but we'll have to wait and see what the pathologists say.
It's quite a big lump, isn't it, for a little chipmunk?
It really is. I mean, if you think how big that is comparative to this animal, it's about half the size of its head.
Yeah.
So for me, that's a pretty big lump.
Big lump.
Yeah. It's pretty difficult, actually, to suture up an animal this small because their skin is paper thin. So it does throw up its own set of difficulties.
The lump will now be sent to pathology. Scott won't be relaxing until the results are back.
So as you say, Sam, we're not out of the woods yet.
No.
To have this little one recover.
Wake her up.
Yes.
Do you want to go straight back into her box?
Yeah, that'd be great. Yeah, could you? Thank you.
Okay, it's right next to you.
Ooh. Ooh. What's that?
It's amazing how quick they wake up, isn't it?
Yeah, it's incredible. Fast metabolic rate.
Good girl.
You're ready to go back in. You got there?
Yeah.
Good girl.
Just pop the lid on that.
Right. Good. No chipmunk deaths today.
You don't want that.
Hooray. I can't wait to deliver the news to Manpreet that Chippy has got through the procedure and has woken up beautifully. I know how worried she's been about this, but now I need to also tell her that that worry continues until we get the results of the pathology back from the lab. Oh, Mum's going to be so relieved. Yes, she is. Eh? Yeah, she is.
You know where we're going, don't you? Hey?
Jo is now arriving for her appointment at the St Margaret's Practice to try to sort out Sydney's chronic breathing problems.
Oh, that's a big sigh.
Hi, Joe.
Hi.
Hi, Sydney. Hello, mate. How are you? Hey? Oh, you're handsome.
He remembers you.
Come on in, Joe. Let's have a chat.
Brilliant, thank you. I'm really worried about Sid. He's really struggling with breathing and just generally being a puppy in the park, and we need to get this sorted.
Yeah. How's things been going, Joe? Still as snorty as ever, I'm guessing?
I'm afraid so, yeah.
So just to kind of go through some of the symptoms, he snores.
Oh, yeah.
When he goes on a walk, does he pant pretty much the whole time?
Yeah.
Yeah. And does he pant for a long time after he recovers from an exercise as well?
He does, and it exhausts him, so he falls asleep.
Yeah. Has he ever collapsed on a walk? Like, has he ever got to the point where he's so out of breath that he's gone down?
No, but he's been pretty close to it, and I've had to carry him home because he just can't get his breath and can't walk.
So he is classic of a lot of flat-faced brachycephalic dogs having this BOAS syndrome, so brachycephalic obstructive airway syndrome.
Wow.
But basically it means that because he's got a short nose and a big domed head, a lot of the structures in the back of the throat are excessive, and those affect his ability to breathe normally. I mean, it's great that he hasn't yet collapsed, but certainly that's where we're headed. And this kind of dog can become blue and purple. You know, they literally aren't getting enough oxygen into their system to be healthy, and then they can collapse. And look, worst case scenario, I have heard that they can die.
Oh.
So it isn't something that we can take lightly, and Sydney's a great dog, and we don't want to get to that point. Seeing Sydney today, it's fairly obvious what we need to do. We need to perform surgery. This isn't fun for him. This isn't a lifestyle that he can endure long term. We need to do something now, and the best option for him is to try and trim the soft palate and make his nostrils a bit bigger. What we're hoping from the surgery is that we're going to have a dog that's going to breathe much easier, is not going to be so stressed out in the summer, and hopefully won't snore as much and give you both a good night's sleep.
That would be good. I couldn't believe that when Scott said he needed surgery. I'm just devastated for Sydney, but also at the same time secretly quite pleased that it's actually going to get him sorted out.
Joe doesn't want to waste any time, so Sydney's surgery is booked in for tomorrow morning.
Hey, mate, we'll sort you out. Yes, we will. Yeah. You all right, sweetheart? Hey? Ready to see Mummy?
24 hours ago, Scott removed a mass from Chippy's breast, and the 4-year-old chipmunk has made a good recovery.
Should we go and see Mummy then? Hey? Let's go. Come on then.
For owner Manpreet, it's been a stressful separation from her precious girl.
It's been a bit nerve-wracking because, of course, I didn't know, how the operation's going to go. So it's been a long wait.
Here's Mummy. Hey.
Oh, hi.
There's your little lady.
Oh, hi, sweetheart.
Say hi, Mama.
Oh, bless.
So surgery went well.
Oh, brilliant.
And we've removed that mass in its entirety. So now it's just a waiting game. We need to find out what it is. The pathologist will give us an idea of that, and then we work out if we should be worried or not. But the good news is at least that I've removed the whole thing and the tissue around it. So hopefully it's good news.
Yeah.
All right.
Okay. I was so nervous before, but now it's such a big relief to have her finally back with me. I'm just looking forward to taking her back home.
See ya.
Okay, bye-bye.
Bye, all the best. Bye, Chippy.
Scott will have the results of the tests in just a few days.
Hello, baby. Mommy loves you.
Hello, who is?
He's coming in.
It's going to be a tense day for Scott's friends Michael and Claire.
He's all right.
No, bless
He's a
him.
bit grumpy.
Their own cat, Winston, is coming into their practice for exploratory surgery.
Here's your favourite little boy, Louise.
Little Winnie.
To find out whether his inflammatory bowel disease has developed into cancer.
There you go, Willow. That was a little...
little evil
that was,
genius cat.
He's just eyeing up the exits, planning his strategy for escape.
Both are concerned about the severity of the 11-year-old's symptoms, especially his weight loss.
Winston.
Oh, Winnie.
It's weird bringing Winston to work for a procedure, but it's also quite weird seeing Claire being so worried about him.
What are you saying? Are you singing?
I'm worried about him as well, but Claire's a worrier, which is what makes her such a caring vet, I think.
You're doing the jabbing, if that's okay.
So I'm bad cop.
Because I get too worried about him.
Yeah, that's fine. 1, 2,
Good
3.
boy, good boy, good boy. Well done.
So it makes you feel what it's like to be an owner rather than a vet. It's pretty nerve-wracking.
He's cross.
Worrying about what might happen to him, if he's going to be okay, is he going to make it through the anaesthetic?
Good boy.
All the kind of usual fears people have that we don't normally feel ourselves.
Come on then, Winnie. Let's go.
I mean, we do it every day to everyone else's animals, but when it's your own, it's just a little bit peculiar. Just got to remind myself that it's for his own good, and hopefully we'll find out why he's losing weight.
The surgical procedure to collect the biopsies can be potentially fatal. But it's the only way for Michael and Claire to know whether Winston does have cancer and needs chemotherapy to survive.
So the biopsies I'm taking here are full thickness biopsies of the gut. So the gut has multiple layers, and we're going to take a sample from the outside right the way through into the lumen of the gut, sampling all the different layers all at the same time. The downside with that is the gut content can potentially leak out, and that can be catastrophic. Okay, how you feeling, Louise?
I'm ready.
Right, good to go, Kim?
Yes.
Okay, right. We're going in.
Let's go. Time for surgery.
At St Margaret's, Sydney is also about to go into surgery.
Sydney, you're here. Hi.
The 7-month-old is suffering life-threatening breathing problems.
So he's here for his nose job today?
Yeah, absolutely. Nose and soft palate.
Receptionist Elle and nurse Gemma are on standby to give plenty of pre-op cuddles.
You left your shoes out. You can chew those any time, can't you?
So when Sydney gets overexcited, you can hear that snorting and snuffling that's, obviously really affecting him.
Sid, look after my fur baby.
I will.
Bye,
we'll
darling.
give you a call when he's woken up from the general anaesthetic. Oh, thank you. Oh, thank you.
Sydney having this operation is going to mean everything for us and him.
Good boy.
Mwah. And he's going to absolutely love getting out in that park. I know it for a fact.
Sydney. Come on then, Sydney. Let's see Uncle Scott.
Hello, mate.
Hiya.
Hello, buddy.
Hi, buddy.
How you doing? You all right?
Gemma and Emma will both be assisting with the surgery. Neither of these experienced nurses have been involved in a soft palate resection before.
So I thought I'd do him a few drawings just so you girls can see what we're going to be doing. The soft palate looks a little bit like this, okay? Gemma, you are going to be my surgical assistant today, all right? What we're going to be doing is I'm going to be putting 2 little sutures called stay sutures in there, like that. You're going to be holding them behind my head.
Yeah.
And then I'm going to lock this bit off.
Wow.
Like that.
Okay.
Is that all right with you? Is that all right with you? All right, let's get to it.
Let's do it.
This particular syndrome of having the long, soft palate and really tiny nostrils can be life-threatening. Dogs can become cyanotic, which means that they have not enough oxygen getting into their system. They turn blue, and yes, they can die if that happens. Come on. Certainly, Sydney is a dog that under anaesthetic will be compromised, so we all need to be sure that we know exactly what we're doing, that our roles are defined, and that everyone's on their top game. Straight away, look how much that soft palate goes into his larynx.
That's incredible.
So you can see it's actually hanging inside his voice box there. That's the problem. Soft palates in French bulldogs are always fairly sizable, but Sydney's is an absolute belter. It is huge. It really is. It looks like a second tongue. Great. Okay, let's move him into the surgery and get going. I do need to take quite a bit away from this to make sure I get the result I'm looking for. Right, so I'm just going to place the stay sutures now.
It's a delicate operation, and now it's time for Gemma to take up her unusual surgical position.
Ready to get close and personal?
Yes. Gonna have a little hug.
I think this is the closest we've ever been.
I feel your
on your ear.
I feel like your hot breath on my neck. I feel like it's more like an experience with a vampire or something.
What are you trying to say?
Gemma and I are good mates at work, but I don't think we've ever been quite that close. Oh, now all I can think about is your hot breath. That's not right, is it, Sydney? Hey?
Sydney, stay with me, buddy. Let's ignore them.
All right, so we're just about to cut now.
Wow.
There we go. So once we've trimmed back the soft palate, we have just got 2 edges that we need to suture together. Yeah, I'm happy with that. That's good. So, Gemma, if you unhook there, thank you.
Now, it's on to stage 2 of the surgery.
Let's embark on that nose job, shall we? Hey? The procedure on the nose is an interesting one because we're taking sections of the nostrils away to actually make the nostrils bigger. But anyone that's ever cut into a nose before will know it bleeds like hell. But very quickly, you can control that just by suturing it into the right position. And straight away, you could see that he had nostrils where he didn't have them before.
Well, that's one heck of a nose piercing.
The difference from one side to the other.
Yeah.
Yeah.
Your sutures have improved. You've been practicing.
That's amazing, Scotty.
That's beautiful.
Like, all joking aside, like, I'm actually really impressed with what you've just done.
I could see Scotty as a plastic surgeon for humans.
Why?
The women would love you coming to get their noses done and their lips done and their boobs done.
You just imagine the consults. It'd be so different from this. Yeah. Instead of being salivated on and attacked by the leg. Maybe actually you would.
Oh, dear. You went there. You went there.
Oh, dear.
A lot of our clients like to think Scott's a dreamboat. So you can just imagine the clientele if he was a plastic surgeon. Women coming in for their lips to be pumped up and things like that.
I think it's perfect, isn't it?
It's a little bit perfect. You can hang your hat.
I know Gemma will say something rude if she doesn't think it is, so come and have a look.
Let's have a look. Inspect your work. So we do have to try and keep Scott's ego under control, but we did have to give him praise this time because it was a pretty good job. I think it's pretty perfect.
Wow, high praise.
I'm scared to say anything about it.
You should be. Go away. You're perfect, Sydney. Good job. All right, let's wake this boy up, shall we? Straight away, as a surgeon, you can see and hear that Sydney's snuffling days are over. Do us to call mummy, eh?
Sydney will sleep off the anaesthetic for a few hours before going home with Joe.
I think we're all super happy with the result. I think in the long run, Sydney is going to be so much happier. We're going to be able to breathe better, going to be able to enjoy life a little bit better. So here's to Sydney and his new nostrils.
No, it's going to feel weird, isn't it?
Funny.
Now that he's under the drapes, I feel completely fine.
Surgeon Michael Hamilton is now starting the exploratory surgery on his 11-year-old cat, Winston.
So the purpose of Winston's operation today is A, to have a look around inside his abdomen at his organs, specifically his intestines, because he's losing weight, but he's ravenously hungry. So we're gonna actually physically look at his organs and we're gonna take biopsies.
Michael and his wife Claire, who is also a vet, are extremely concerned that Winston's inflammatory bowel disease has become something a lot more frightening.
Given his age, given his breed, unfortunately, he could potentially have developed cancer of his gut, which is not uncommon in cats who have inflammatory bowel disease.
So how's it going?
It's still going fine.
I'm not scrubbing in today because I find it too emotional to get involved when one of my pets is under anaesthetic. I was just get a bit too anxious and stressed.
Okay. So the first thing we're going to do is just check his gut from one end to the other. And anything that looks abnormal, that's specifically where we'll take biopsies from. This is a bit of small intestine, which I have to say looks pretty good.
Knowing Claire is so worried, Michael is doing his best to lighten the mood.
At the end of the large intestine is his bum. And on the other side of that is a big Winston poo down in there.
I hope you know how to get all that back in, Michael.
Yeah, it kind of, yeah. He's not got much of a pancreas here, I have to say. We're definitely going to take a little piece of that and send that off to the lab. Just going to check one of his his kidney down in there. There's his liver. His liver looks actually pretty normal, which is good. There's no lumps, there's no bumps, and it all looks normal. So I'm really happy what we found here, more to the point what we haven't found.
With no obvious signs of cancer, Michael has to take a series of biopsies to make absolutely sure Winston can be given the all clear.
Yeah, so this is a little piece of Winston's liver.
As well as liver and pancreas biopsies, Michael takes a further 4 samples from the different regions of Winston's gut.
So next thing we're going to do is we're going to take a little bit of his stomach. This is a full thickness biopsy, right the way through all the layers of his gut. And by doing it that way, hopefully we won't miss anything.
Although Michael has carried out this procedure many times, he's well aware that if Winston's gut is abnormal and does not heal properly, there is a real risk of serious complications.
It's high risk because you've basically made a hole in the gut. The gut content can potentially leak out. That is a big, big problem, and that's the major risk with this particular procedure that we're doing here. It can get really, really ill really quickly. It's called peritonitis, and it kills kitty cats and it kills people too. Done. Okay, so we've got all of our biopsies now. We are good to close him up. So you should hopefully bounce back relatively quickly from this.
He's going to be cross when he wakes up.
Not if he wakes up in your loving arms. There he is. Hello, mate. Once we've finished the procedure, we're going to be watching him like a hawk for the next 2 or 3 days to make sure that he's not getting a really painful abdomen, spiking a really high temperature. Because if he's going to get peritonitis, he's probably going to get it in the first probably 2 or 3 days.
I'm going to bed. It's Mummy.
It's my little body boy.
Yes. There you are, cutie pie.
Was he a good boy?
Yes, he was.
He hasn't been cross?
No, not yet.
There's
Give it
always
time.
You all right, Warrior?
Much better, thank you. Yeah, much better now.
Yeah.
Much better now.
It all looked normal in there, Claire. So
Yeah, good.
Probably home in a day or two once we're happy that he's all right. So yeah, and then just wait and see what the biopsy says.
It will be several long days before the lab results come back, showing whether Winston is clear of cancer. Only then will Claire be able to stop worrying.
I will be nervous when we see the pathology results for the first time, but I'm just really happy that he's waking up and he's okay. You're all right, little man. Little man, it's all over now. Oh, the horrible bit's done.
Hello, mate. How you going with that new nose?
It's been 4 hours since Sydney had his nose job, and a large section of his soft palate removed.
Come on, big boy. Here we go. Let's go find Mummy.
Already, the French bulldog's breathing has improved.
Hi! How did it go? Very good.
Upstairs, owner Jo is just arriving to take her puppy home.
Without Sid at home today, it's been really quiet. Quiet in the fact that he's not running around under my feet, but also quiet because he's not been snorting and shuffling and snuffling in the background.
Oh, here he comes.
It's going to be quite strange going home and him being there and still being silent, but knowing he's there.
Oh my gosh, Sid! Hello!
What you think?
Hello, it looks amazing!
So the surgery went really well. We trimmed that soft palate, so hopefully he won't be gurgling as much. And then as you can see, he's got some, well, he's got nostrils. Didn't have them before.
They're excellent.
Yeah, I'm really happy. He's done really well and breathing quite quietly, really, considering he's still quite sleepy.
Yeah, that's excellent. Thanks, Scott.
I think Sydney looks amazing. I can't believe the difference already in the nostril size.
With all the swelling reducing over the coming days, I think he's going to just get better and better and better. And hopefully then you'll be able to walk in the park, enjoy the great outdoors, even in hot weather, with a dog that isn't making so much of a racket.
Well, Sid, I can get you home.
You got him. All right, bye, champ. Bye, mate. Bye. Nice nose, by the way.
Thanks, Scott.
See you, Jo.
soon.
All the best.
All right, take care.
Bye.
Bye. Come on, Sid.
See ya.
Bye.
Bye, Sid.
Say bye.
Bye, mate. Bye. You're so cute. Hi, Manpreet. How are you? Great to see you.
Scott has received the test results for Manpreet's 4-year-old pet chipmunk.
Hello, Chippy. How are you, sweetheart?
Today he will deliver the news and check up on little Chippy.
How's she been?
She's been okay. She's been really good. She was a bit quiet for the first few days.
5 days ago, Scott operated to remove a worrying lump from Chippy's breast.
It looks like it's healed quite well.
Mm-hmm.
The only thing is that I do feel there's a little bit more of a lump that's developed further down.
And that wasn't there before?
No. I never expected to find another lump. All I was doing was to make sure that the suture line had healed well and that the lump that I previously removed had gone completely. And the unfortunate thing is the results from the lump have come back, and it's come back as a not a very nice type of tumour. And it's already spread out into the tissue surrounding. I think it's a good chance that, sadly, this will take her quite quickly. And the fact that it's already spread the way it has, it's really not good news at all, I'm afraid. I'm so sorry.
Thing. So do you think she's in pain at the moment then, or?
I don't. I feel, you're still very active, aren't you? I don't think that she's in pain, but this tumour is likely to progress quite quickly. I really wanted it to be okay.
Oh, no. I don't know, in my mind, I just thought, oh, she's had the operation and she'll be fine.
And you've given us such a wonderful life, you really have. And what I love about you is that this is a little tiny furry creature and people might go, oh, it's only a chipmunk, but it means so much more to you.
Of course, she's my baby. It's like my little kid.
I know.
That's why it's so heartbreaking, because she's brought us so much joy in the last 4 years.
She knows how much you love her, and I know how much you love her, and you just need to keep doing that, okay?
Yeah.
Because she's lived so much longer than she would have in the wild.
Yeah.
By being cared for so beautifully by you. Okay?
Yeah.
And I'll be here. Okay, so if you need to speak to me about it, if you want to just have a cry on a shoulder, then I'm here.
Thank you.
Because I do know that this little creature, however small, has a big part of your heart.
She does, definitely. Both of them.
My baby. You've been such a sweet girl and such a good little patient. You'd never know, would you?
No, I know, exactly. She's so active.
And
She's such a good girl.
And that's one thing you do have to take away, is that ignorance is in fact bliss. And right now, she's like, oh, look, I'm doing somersaults. Aren't I hilarious? And, oh, look, there's my mum, and I love her.
Bless. I tell her that every day. I love her. Sometimes I think she probably understands, right?
Of course she does.
Are you glad Mr. Winston's home? Good girl. Good Mr. Winston.
It's also been an anxious time for Scott's great friends, the Hamiltons, after their pet cat Winston underwent exploratory surgery.
We've had Winston's results back and they've been able to rule out cancer, which is brilliant news, and we're so relieved and so happy. They've confirmed he does have inflammatory bowel disease, which we knew he's always had. That's okay, we can manage that.
With no need for chemotherapy, a relieved Claire now has Winston back on steroids.
This is food for Mr. Winston.
And already he seems to be coping much better with his inflammatory bowel disease.
Should we give him his tablets to make him better? Are you making Mr. Winston better? Yeah, clever girl.
Maya's getting very involved. She's absolutely fascinated by it. If I left it to her, I think she would treat him about 8 times a day.
Yeah, good girl, well done. More? He's going to get really fat.
So far, so good. He seems to be getting a lot better. He's brighter, he's a lot happier. He's certainly improved in his demeanour. He's improved a lot. And he's more playful, happier. He seems already a lot improved, yeah. Really happy.
Good boy, Mr. Winston.
And 3 weeks after performing no surgery on French Bulldog Sydney,
Hello, mate. How are you? You're looking fantastic. Hi, Joe.
Hi.
Scott has organised a date in the park to check up on his handiwork.
He looks amazing.
Look at that nose. Hey? Oh, what's that sound I hear? The sound of silence.
Exactly. No snoring.
Yeah. When I first met Sydney, he was a noisy dog. I mean, even at rest, he made a racket, but when he was exercising, he would snort, he would snuffle, he would pant. It was all very distressing and far from normal. But now I know the surgery's been a success and he's a happier dog because he's a quieter dog. So how's it been going? Obviously, he's breathing a lot better.
Loads better. He's playing with dogs in the park, he's running. Since the operation, he's now enjoying his dog life to the max. And as a family, we can see a different change in him. He's really enjoying himself out and about. You ready? Go on then. It was a massive bonus for all of us, him and us. Good boy.
He's never going to be a beautiful gazelle running after, you know, the wildebeest in the park. He is always going to have a short run before he's going to be a bit out of breath. At the end of the day, he is a French bulldog. Built like a tank, with a flat face.
Yep.
But you think he's much more comfortable enjoying life.
Absolutely. It was the right call to do the operation.
That's good, isn't it? That's good to hear.
Yeah.
Hey?
Oh, Sid.
Oh, you big wuss. Hey? What a good boy. Did the nose job help with the ladies at all? Huh? Hey?